Good morning, everybody, and welcome. I think this is the first session in the Health Careers Live conference. I'm really pleased to be able to be here and speaking to you. My name is Abby, and I'm from the NHS Health Careers team. And I'm here just to give you a bit of an overview, really, to kind of kickstart the day, talk through some of the opportunities that there are in the NHS in terms of careers, some of the roles, some of the routes in, and also show you some resources so that you can go away and have a look. So some of you might have joined today because you are really clear on what you want to do in the NHS, and you're here just to kind of get some more information, ask some questions maybe. Some of you might be here because you're thinking about a career in the NHS, but you're just not quite sure what you might want to be heading for. And so hopefully this session will kind of get you thinking, give you some ideas, and set you up well for the day. So yeah, I hope you enjoy it, and I hope you have a great rest of the day as well. There are loads of really good sessions on offer, and I'll be able to take questions at the end as well. So please do make sure you put those in so that we can respond to those this morning. Okay, so we will get going. So there are over 350 different roles in the NHS, and I think that's something people often don't realise. You know about the obvious ones, you know about nurses, you know about doctors, you know about physios, paramedics, midwives, but there are so many others that a lot of people just aren't aware of. Some which are very much patient facing, providing that hands-on patient care, but many which are more behind the scenes, and they're often the ones that people aren't aware of. But the important thing, and the thing that binds all of those roles together, is the fact that you're making a difference to people's lives, whether you are dealing hands-on with a patient or whether you have no contact at all with patients in your day-to-day work. You're making a difference if you're working in the NHS, and that's a really important thing to remember. Some of the other myths around the NHS are that, you don't have to have a degree. Sometimes people think, oh, I'm not going to be academically able to get into the NHS, but there are so many different roles and routes in, and we'll touch on some of them as we go through the presentation. Okay, so what we're going to do, just a little bit of background and kind of context, talk about some of the roles on offer, how you get into those roles, the different kind of entry points, a little bit about financial support. We all want to know about, what money can I get if I'm doing that training program? That's important. Where you can find out more, and also then using the NHS Jobs website, because that's a really useful tool. So a little bit of background then. Although the NHS is kind of one umbrella organisation, it delivers its healthcare through many hundreds of different organisations, whether they be NHS trusts, GP practices, and other types of organisation, but they are separate employers in their own right. So this means that if you're looking for vacancies, if you're looking for apprenticeships, maybe work experience opportunities, volunteering opportunities, there can be different things on offer from these different NHS organisations. So it's just a really important point to bear in mind. The other thing we see as well is that different NHS organisations might call the same role a slightly different job title. So again, that's just something to look out for. Okay, so what sorts of careers are there then? So we are in the NHS Health Careers team, we tend to talk about the careers in these categories that are set out. And I realise it depends what kind of device you're watching on, but I realise these could be quite small, particularly if you're watching on a phone. But the thing is that it's difficult to categorize. It's never perfect categorizing these job roles, but this is what we do at the minute. This is how we categorize them. And I think the thing you'll notice straight away is the number of categories and also the variety. So you've got everything from the allied health professionals, and I know there are quite a lot of sessions at today's event on the allied health professionals. Really great group of staff, so do go and find out more about those. Many different roles in this group. It's a large group of staff, and they are all kind of aiming to support patients to kind of live their fullest life, whether that patient has maybe a disability or has had surgery or a long-term condition to manage. Whatever the position that patient is in, the allied health professions will work with them to try and enable them to live as full a life as possible. So really, really exciting roles involved in, diagnosis as well as treatment, rehabilitation, etc. And working in many different settings as well. And that's another important thing about the NHS. It's not just about the hospitals. You could be working in patients' homes, you could be working in GP practices, you could be working in schools and colleges or in prisons. There are many, many different settings, lots of really exciting and new settings that are being tried out as well. Then we've got the ambulance service team, so not just paramedics, but also call handlers as well, medical dispatchers. The dental team, so again, that's not just dentists, but you've got technicians and the dental nurses as well, hygienists, therapists. Doctors, so we've all heard about doctors, but did you know how many specialties there are within medicine? So over 60 specialties once you've done your initial qualification. Estates and facilities, really important roles here, looking after the buildings. So we need engineers, plumbers, electricians, surveyors, and people who are going to procure goods for the NHS as well. Health informatics, this is a really growing area. So we know that we need people who understand data, who can analyze data, report on it in a way that other people can understand, who are confident with IT. Because at the end of the day, we use data to improve the quality of the patient care. So all things IT are covered within the NHS. We need website developers, and you may not have realised that, but that are a little bit hidden. And that's part of the reason for this session, to try and kind of bring those to light a little bit more. Healthcare science. So again, some really exciting roles here. Some of them very much laboratory based, but others that are very patient facing, where you're very much involved in the diagnosis and management of patients as well, and many different specialties too, and different routes in. Management then of all sorts of kinds, so whether that be people management, money, buildings, general kind of management, project management, again, lots and lots of opportunities at lots of different levels. The medical associate professions, this is quite a small group of staff here, and the main one probably to highlight for you today is the physician associate role. So this can be trained for either as a postgraduate route, or there are 2 universities in the country now offering an undergraduate route, which is a 4-year master's programme to become a physician's associate, working very much in the medical team alongside doctors, but providing really vital care, again, in lots of different settings. Midwifery then we've all heard about, so midwives, but also the maternity support workers working alongside midwives. And then nursing with the 4 different fields. So we've got adult, children's, learning disability and mental health nursing. And also the nursing associate role, which is relatively new to the nursing team and sits somewhere between kind of healthcare support worker and registered nurse, again employed in lots of different settings. And no, it's no longer just a support role for doctors, which is kind of back in the day, that's very much how it was perceived. But nurses now are, practitioners in their own right. You can become a consultant nurse. You can have your own caseloads of patients, specialise in all sorts of different areas, get into research. The nursing profession has an awful lot to offer. Pharmacy team then, so not just pharmacists, but also pharmacy technicians, pharmacy assistants as well. So lots of opportunities there. And the psychological professions, which are also growing massively and have a lot more practitioner roles on offer, as well as the roles like clinical psychologist that you've probably heard of already. Public health, I mean, they've had their time in the spotlight a bit over the last couple of years with the pandemic, so we've found out a little bit more about what they do. But if you're interested in science, you're interested in people, how you can kind of improve population health, protect the population from threat, then you might want to look into some of those roles. And then last but definitely not least, the wider healthcare team, which incorporates all sorts of services that help keep the NHS running, whether that be the procurement side of things, the support workforce, lots and lots of different roles in there that you might want to have a look into. Okay, so just to give you a few ideas then, if you're sitting here thinking, okay, I'm not sure what's for me. If you enjoy using very practical skills, there are just a few ideas on this slide. This is by no means an exhaustive list, but it just might give you a few ideas as to the sorts of roles that might suit you. And you can see there everything from very, very kind of practical hands-on non-patient facing roles like carpenter, motor vehicle technician, through to much more hands-on roles like occupational therapist, prosthetist, drama therapist, lots of options there. Or maybe you'd really like to work with children, and there are lots of options here. Again, you don't have to be a paediatrician or a children's nurse. There are lots of other ways that you could work with this group of patients, maybe as a school nurse, newborn hearing screener, child psychotherapist. Again, this is not an exhaustive list, but just to get you thinking about some of the options that might be out there. Or perhaps you really enjoy science and you want to use it in a way that is helping people and making a difference to people's lives. It won't be any surprise that there are loads of options here. So again, just a few kind of tasters on this slide really to get you thinking, and so that you can go away and look into these roles in a little bit more detail if that's what you wanted to do. Okay, so that's a very quick run through of kind of some of the roles, and obviously we haven't got time to talk through all of them, but I'd really encourage you to get onto the Health Careers website. It's healthcareers.nhs.uk. I'll make sure the link's up on the final slide as well, and have a look in the Explore Roles section. That's where you'll find the pages of information about some of these roles that I've been talking about. So how can you get into them? So the good news is that really, depending whatever point you're at in your life, there are ways to find out more about the NHS, to join the NHS, to get involved. So, don't kind of think, oh, well, I haven't got science GCSEs, I'm not going to be able to get a role in the NHS. That's just not true. There will be something there for you. So a lot of people start off with a little bit of work experience maybe, and I'll talk a bit more about that later. Volunteering as well is a great way of getting some experience. It also demonstrates to employers that you're willing to commit to something, whether you're going for a couple of hours after school or college every Wednesday evening or whatever it is. You're showing commitment, you're showing that you can turn up on time, you're showing that you're taking it seriously and you really do want to kind of gain that experience. And remember as well that it doesn't necessarily have to be healthcare experience if you're wanting to get into healthcare, because you can show your experience and demonstrate that you hold similar values to the NHS in lots of different ways. And again, we'll come back to that in a little bit, but it's really important. There are entry-level roles as well, where you may just need maths and English GCSEs. Sometimes you can even be, if you haven't got those, you can be supported to gain those or the equivalent as part of your role. So there really is something for everyone. Or it might be that you go for an apprenticeship, and these are available at lots of different levels, and we'll talk more about those shortly. Or maybe you're going to college, you're going to maybe do a level 3 health and social care qualification, or you might be studying that at the minute. That can be a great entry route as well into the NHS. Or maybe after a diploma, or there are many roles that do require a degree. So for example, nursing, the AHP roles, medicine, dentistry, all require a degree level qualification. And there are a few roles in the NHS that require, if you want to be a psychologist, you need to do doctorate level training. That's just how it is. If you want to become a clinical scientist, which is a protected registered title, then you would need postgraduate training. And also you might have gained experience outside the NHS, maybe, it could be in retail, in the private sector, many different settings, and you'll be bringing life experience, transferable skills into the NHS, and they are all really, really valuable to the NHS. Just wanted to give you a little bit of an idea of some of the apprenticeship vacancies that have been advertised in the NHS over the past couple of months. So I've just picked a few out. This is not all of them. There have been loads more, but I've just tried to select a little bit of a variety so that you can see the sorts of things that are available. So we've got everything there from apprentice emergency care assistant, so that's with the ambulance service, data technician, a trainee nursing associate, that's a level 5, that's a foundation degree level apprenticeship. Operating department practitioner, that's the degree level apprenticeship there. biomedical support worker, registered nurse degree, pharmacy technician, nursery nurse, psychological wellbeing practitioner, and an outpatient booking apprentice. So a selection of hands-on patient caring roles and also some more behind the scenes roles there as well. So just thought I'd kind of show you those so you can see the variety. You'll find apprenticeship vacancies on the NHS Jobs website. They should also be on the Government Find an Apprenticeship website, but we do find that sometimes things fall between the gaps. So definitely look on both websites to look out for those opportunities. And there are now degree level apprenticeship standards available in all these different roles. So when the process is that an apprenticeship standard goes through an approval process, and then it's up to employers to work with an education provider like a university to decide whether or not they are going to offer these vacancies. So all of these degree level apprenticeship standards have been approved and they are available, but in varying numbers. So some of these are advertised very, very rarely, others much more frequently. So that's just a bit of a kind of a health warning, if you like, on these, that just because an apprenticeship standard is approved doesn't mean to say we're seeing a lot of vacancies yet, but it is growing. We've certainly seen that with the nursing degree apprenticeships, that we're seeing more being advertised, which is great news. In terms of going off to university to study a course, all of these courses are available as full-time undergraduate opportunities. So you're probably aware of some of these, but you might not be aware of all of them. Now, medicine and dentistry in terms of funding have got a slightly different funding arrangement. So there is financial support for the final year of a 5-year degree, which is the kind of standard undergraduate degree length. The ones that are in bold there do actually, eligible students will be able to access what's called the NHS Learning Support Fund, and I'll touch on that a little bit more in a minute, but there is some funding available if you're studying those courses. Okay, so the NHS Learning Support Fund. This is all administered by the NHS Business Services Authority. The web address is on the slide there, so it's nhsbsa.nhs.uk, and you can find out all the detail if you go to that website. So there is now a training grant of £5,000 a year for eligible students studying nursing, midwifery, and most of the allied health profession pre-registration courses. So that means courses that lead to you being able to register as a qualified nurse, midwife, or AHP. Now, the eligibility criteria are actually around whether or not you're eligible for student finance. So if you're eligible for tuition fee loan and maintenance loans, then you should be eligible for this NHS Learning Support Fund. £5,000 a year doesn't have to be repaid, okay? It is a grant, it is not a loan. That's the good news, and it gets paid in termly instalments during your course. Now, there are other elements of the fund. So if you've got children that you're looking after, there's £2,000 a year parental support. If you're studying mental health nursing, learning disability nursing, radiography, podiatry, prosthetics and orthotics, or orthoptics, you get an extra £1,000 a year because those are harder to recruit to courses. So you'd get £6,000 a year as your kind of basic grant. And then if you're having to travel distances for clinical placements, then you are able to claim some money to help towards those as well. And there's also an exceptional support fund. So this is really, really good news. And if you, as I say, if you want to find out more, then check out the NHS Business Services Authority website, and all the detail is on there. They've got an online portal, and that's where you apply for that fund through. Okay, the other good news is that even if you have already got a degree and you want to study a healthcare degree as your second degree, there is a different arrangement because we want to encourage people to do that. So you are usually able to access a second round of student finance, and but will still be available. So that's really, really good news. Okay, just want to talk a little bit more about apprenticeships and just show you a couple of apprenticeship pathways, just to give you a little bit of a taster of what is available via some different routes, because it's great that we've got these options now. It's not all about going to university. You can earn while you are learning and gaining your qualification as well, and that's what suits some people depending on their learning style, but also their financial situation as well. So, for example, to become a healthcare science practitioner at degree level, you could start off as a healthcare science assistant, level 2 apprentice, move on to a healthcare science associate, level 4, and then on to the degree level healthcare science practitioner programme, if that was available. To become a therapeutic radiographer, for example, again, you could move on through the apprenticeship pathway to gain your degree level qualification and become a registered therapeutic radiographer. Exactly the same qualification as if you've gone to university and done that degree. That's really important to note. This is not a different type of qualification. It is the same qualification, same registration, but you're just doing it through a different format. Into nursing as well, lots of different routes in now. So you might just have GCSEs and then get a place on a nursing associate apprenticeship programme, and then that could enable you to do a shortened registered nurse degree apprenticeship, so to kind of top up your nursing associate apprenticeship to get that degree level qualification and that registration as a nurse with the Nursing and Midwifery Council. Or you might go up through apprenticeship route from earlier on, so GCSEs, and then move on to healthcare support worker apprenticeship, senior healthcare support worker apprenticeship, and then potentially onto a registered nurse degree apprenticeship. Or you might have GCSEs and no level 3 qualification, so that's equivalent to A levels. So an access course is a great way to get that, and then that would give you what you would need to move on to a nursing degree. Or, as I said, you could do a postgraduate course, so you could have a first degree in any subject, get a bit of experience, and then get a place on a shortened graduate entry nursing degree, which would usually be a 2-year programme rather than 3. So loads and loads of different options there. Okay, let's talk a little bit about work experience, because people do get quite kind of worried about being able to get work experience. There isn't a lot on offer, and obviously during COVID it's been even harder, and some of you might have, that battle might be very, very real in that you've been trying to get some work experience. First of all, try not to panic about it, okay, because employers and course providers do know that it can be really difficult to get work experience, so don't worry. Look to see if there are any very specific requirements, because sometimes a course or a job do have quite specific requirements. Think very broadly. It doesn't have to be hospital-based experience. You might be able to go and help in a care home. It might be that you'll help out an elderly neighbour with shopping or support of other sorts. It might be that you can volunteer with a charity. There are lots and lots of different ways to gain experience. Even if you're working in a shop, you're delivering customer service, and you are starting to evidence that you hold the values that align with the NHS values, and then the next slide is about that. Think about volunteering as well, and look online. There are an increasing number of platforms that offer, obviously it's not work experience as such, but work related learning or insight opportunities. So there's a platform called SpringPod, there's Observe GP, and there are some others that are kind of appearing that are offering, it's basically opening up the opportunities to more people. Get in touch with your local NHS organisations though, and see if you can get hold of the work experience or volunteering manager and see what they've got on offer. But use examples from all areas of your life to evidence that you're right for this course or this job, because it could be from your family life or your school or college life. Have you been involved in, I don't know, running clubs, or just involved in clubs full stop? Teamwork, what's that taught you? What's that taught you about communication? There are lots of ways to evidence your skills and your experience. Values-based recruitment is really important. This is something that the NHS is doing now across the board, because we don't just want people who hold the right qualifications. We want the people who have got the right values that fit with the NHS values. So there are 6 values: working together for patients, respect for lives, and everyone counts. When you are writing your personal statement or your supporting information, when you're preparing for that interview, make sure you've got examples of how you live these values. That is so, so important. It is just as important as the qualifications and experience that you have. So think very, very carefully about those. Okay, just to come on to some resources then before we answer some of your questions. So the Health Careers website, lots of information on there. There is the Explore Role section, as I mentioned. So check very, very carefully through the role pages there. You can find out lots more information. You could do a careers quiz. So underneath the Take Our Careers quiz tab along the menu there is a Find Your Health Career tool. So if you are one of those people who are just not sure what kind of role might suit you, have a go at this. It just takes a few minutes, series of statements, and depending on how you respond to those statements, the tool will then bring up some suggested roles that fit your skills and interests. So, and then you can click into those and find out more. So do have a look at that. We've also got a course finder tool on the website. So this, what we do here is we list the courses that lead to professional registration in one of the healthcare professions. So it can be, you know, obviously UCAS is great, tons of courses on there, but sometimes it's not always easy to spot which courses lead to professional registration in one of the healthcare professions. So that's why we've got our course finder tool. So you can search by profession, by region, by type of qualification, and also by full, part-time, and also there are some blended learning courses now where the majority of the learning is delivered online, so you can search for those as well on the website. And then you can click through to the university website, and that's where you'll find the entry requirements, which is obviously absolutely vital to check out because they can vary so much for the same course, as I'm sure a lot of you have found out already. We've also got a kind of younger sibling website, which is called Step Into the NHS, aimed more at key stages 2, 3 and 4 of the school years, more kind of bite-sized information on there as well. Okay, just want to mention the NHS jobs website. So this is where all vacancies in the NHS are advertised. It currently looks like this, but actually there's a new version of the website due to be launched literally in the next few weeks. So it'll look quite different in the next few weeks, but a lot of the functionality will be the same or improved. So you can search for jobs and apprenticeship vacancies on this website. You can register with the website, and then that enables you to save your searches and set up email alerts for suitable vacancies. So that's a really, really helpful bit of functionality on the site. And you can search within a certain postcode, certain radius of a postcode, and using keywords. So lots and lots of different ways. There is also a section kind of advice for job seekers and help on applications, interview tips, that kind of thing. So that's really helpful. And what you'll see if you see a vacancy on NHS Jobs you're interested in, you'll see a named contact. That person is there for you to contact if you've got questions about the vacancy, if you want to arrange an informal visit to the department. Use that named contact. If you can do that even before you apply for the job. Don't be afraid to to get in touch with them. And if you want to get in touch with your local NHS employer, maybe because you want to find out what work experience opportunities there might be, what apprenticeship or training opportunities might be coming up, then under the Browse Jobs tab on the NHS Jobs website, you can find a map, and that will help you find contact details of your local NHS organisations. Okay, and here we go. So here are some links here. So please do ask questions if you've got them. Look at our websites because there is so much information on there. You know, I've only got limited time today and we can only touch on some of the things and not in a lot of detail. So I've tried to just give you a little bit of an overview, and hopefully then you can go away and find out more. Do follow us on social media as well. We are doing more and more social media live events where we sometimes have panelists who are either healthcare students or professionals. If you should ask, then do get in touch with our contact centre. You can either email them or phone them, or get in touch through our website underneath the Contact Us tab. So lots of different ways of getting your questions answered. I really hope that's been helpful. So I'm going to stop sharing my screen now and see if we've got any questions. thank you very much for listening. So I can't see anything in the chat at the minute, but do let me know if you've got any at all, and I can respond to it. Maybe it's too early in the morning for questions, who knows? Okay, well, I can't see any questions in the chat, but if oh, I can't hear you.
And we are back. Abigail, it's very nice to hear you speak this morning. Very inspiring and really filling some of the participants today with a lot of enthusiasm about working in the NHS and the futures that are available to them. So thank you so much for that.
Oh, pleasure.
We've got a few questions now from some who are in the chat, who are listening at the edge of their seats to everything you had to say. And after that, we've got a few other points to get through as well. So I'll just go through them. So Joanna asks, if you already have a nurse qualification, can you get funding for a second field?
Oh, that's a really good question. Yes, you should be able to for your second field of nursing still, and the NHS Learning Support Fund as well, I believe. Yeah. So yeah, it's a great to qualify in a second field normally only takes about 18 months once you've got your initial field qualifications. So yeah, it's a great way of expanding your role. Good luck.
Good luck to you, Joanne. Our second question is from someone with no name, unfortunately, but they've got a great question. As a doctor, how can you go about getting into management?
Really good question. I mean, a lot of healthcare professionals do end up kind of moving into management. You'll just spot opportunities, take those opportunities as they come up. So it might be that you start off wanting to do a bit of a project, or it might be that you're asked to kind of help out with something. There are lots of ways to move into it, and you are obviously you're immersed in the healthcare setting anyway, working as a doctor, so you start to notice what's happening in terms of management, and you can use that experience then. And actually, if you're bringing clinical experience to a management role, you're bringing a lot of great skills and experience with you. So yeah, definitely. And then you look for those opportunities on NHS jobs, and you look at the person specification, and you look to see whether your skills and experience match that, and then you go for it.
Fantastic. Well, good answer, and good luck to that person who's looking to get into management. We hope to hear back from you in HCL future years and tell us about your journey. Moving on, we've got Shrivangahan, who says, to do a clinical attachment or observership in the NHS, do we need to contact the trust or the consultants directly?
Okay, yeah, that's a really good question. It's something that people do kind of worry about. So if this is something that is out, I'm not quite sure whether this is part of a course that you're doing. I mean, if it's part of the course, then usually the education provider will help you source a placement. But if something that you're trying to organise yourself, I would knock on as many doors as you can. So usually things like work experience placements are arranged centrally. So there should be a central point of contact that you can get in touch with, work experience manager or coordinator. So get in touch, go onto the Trust's website, put work experience into the search bar, see if that brings anything up. If it doesn't, just phone the main switchboard number and say who you're trying to get hold of and get put through. But yeah, knock on lots and lots of doors, and keep trying. If you look for work experience placement, don't kind of go in there thinking you're going to end up with a really massive work experience placement. Be realistic. It might be that you can only get a few days here ever, because it will all be helpful towards kind of building your experience.
Yeah, and I would agree wholeheartedly. Knock on as many doors as you can. To further yourself and your career. People want to help you, but you've got to put yourself out there. And by the amount of support that's available, once you do start, putting yourself out there, people who have this experience, they want to pass it on to the next generation. So good luck to that person in the chat. The next question we've got for you is, I want to ask if specialities offered in the NHS include uncommon specialities, such as forensic medicine. And that's asked by William Nathan.
Yes, so there are opportunities in forensics in the NHS, both through the kind of the healthcare science and medicine route, but also in the psychological professions as well. So I would get onto the Health Careers website, and you could just put forensic into the search bar there, and then it'll bring up some of the roles that you might be interested in looking into. So yeah, good luck and enjoy the research. That's all part of the process as well, isn't it? That's the fun bit, kind of finding out.
Absolutely. And we've got one more question here, and this is from Pakiza Muskan, and she or he says, could you please tell us a bit more about what's involved in physiotherapy, and are physiotherapists from other countries able to join the NHS as an NHS physio?
Great question. So I would highly recommend that you stay in this event today to find out more about physiotherapy, because I know you've got some really great speakers coming up who are from allied health profession backgrounds. But essentially, physiotherapists can work in all sorts of settings. So you might be working in an intensive care unit and you're very much helping the patient to even when they are on a ventilator. You can be helping with the management of their chest and their breathing, and also keeping limbs moving. You might be working specifically with children. You might be working in people's homes, helping people to rehabilitate after strokes, for example. You might be working on a surgical ward, helping people kind of get back on their feet after all kinds of surgery. So there are so many different work as a physio, but I won't say any more than that, because I think you should stay on and listen to some of the other sessions today. In terms of working in the NHS as a physio, if you've trained overseas, that is absolutely possible. Physiotherapists in the UK are regulated by an organisation called the Health Professions Council. So you have to be registered with the HCPC to work as a physio in this country. But there is a process that you can go through if you're abroad. What that is, but if you've trained abroad, you can go through a process to become registered as a physio and work in the UK in the NHS.
It's all right. I think we got the gist of it, and I'm sure whoever's else in the chat, we can have one of our team reach out to them and confirm some of the things that you said to them later on. And that's for anyone. If you've got any questions, you just do be in touch with our team, and we'll try and answer whatever we can and refer you to the appropriate experts in the field. Us here at the team, Health Careers Live Conference, is if you could give one top tip to young students and young professionals looking to get involved in the NHS, what would that be?
Oh man, that's a hard question. Just one. Okay, I think I would say remember why you want to do what you do, because it's all about patients at the end of the day, and take opportunities. There you go. Those are my 2 tips.
Fantastic. So you heard that, guys. Get that glued onto your wall and look at that every day, and you're going to do just fine. So much, Abigail, for that amazing session this morning. Great introduction to today, great introduction to the speakers, and I hope that's filled all you at home and watching from schools, universities, wherever else, with a lot of enthusiasm about the program that we have available to us today. We're going to jump to a quick break straight after this, and hopefully we'll be back in just a few minutes with some of the presenters from the morning. Let you guys know that we've got 3 stages available today. We've got the AHP stage, we've got the Inspire and the Discover. So there's so many speakers and so many professionals available to us today. So whatever it is that you're interested in, there's somebody there for you today. So looking forward to getting that under the way. And thank you once again, Abigail, for a great session.
Well, thank you for having me.
My name is Mark Radford. I'm the Chief Nursing Officer for Health Education England.
I'm Sarah. I'm a neurosurgery trainee currently working in Cambridge.
I'm Adrian James. I'm the President of the Royal College and I'm really delighted to be here.
My name's Abby and I'm the Careers Information and Quality Lead for the NHS Health Careers team. I hope to be able to get across to you some of the amazing opportunities within the NHS.
We have got podiatrists, occupational therapists, speech and language therapists.
So we're going to talk about good medical practice, we're going to talk about protecting patient safety.
Because of the restrictions, because of remote working, because of a lack of face-to-face contact, because we have to manage patients a different way, we've had to think differently about how we manage this work and how we use technology.
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi, Ian.
Hey guys.
We are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future.
It's been really interesting hearing all your top tips. I've got my list now. I can pack my bags. I'm going to wear my seatbelt for safety, but I am going to look out the window ahead of me and enjoy the trip.
It's just about us finding the greatness within us and bringing it out and being our best self.
Health Careers Live Conference 2022. Very welcome to all of you from all over the world and all over the UK who have tuned in for this fantastic day. Lots of great speakers. I want to start by saying congratulations to the HCL team. This is our 5th year of running this. We've been able to touch the lives of many students and allied health professionals, doctors, nurses, everyone all over the world for a number of years, and our presence is only growing. And we're really inspired when we hear the stories of all those that we've been able to help and come back and help others along their journey as well. It has been a testing time for us with the unfortunate passing of the Queen, a true sign of dedication and an absolutely amazing monarch. And unfortunately, because of that, we had to delay this year's conference, but we were happy to do that in terms of showing our respect to the Queen and her great service over a many number of years. As I mentioned earlier today, we're going to be over 3 stages today. So we've got Inspire, we've also got Discover and the AHP stage. So a multitude of resources available to you to help you in whatever way you see fit. So hopefully check out some of the things on the other streams, and we've got some lovely talks right here on this channel as well. Just want to let you guys know that, for all you students who are watching, you are really the future of our NHS, and we are here to help you. We're here to help you along that path, pave the way for you so that you can take over, from the generation who's running it at the moment. So please get in contact with our team. Any questions you have about the careers, about the options, about the pathways, let us know and we'll try our best to help you on your journey, as I'm sure many of you will, to the next generation after you. So if you haven't, check out our social media as well. I'm sure there'll be some links in the chat where you can get involved, spread the hashtags and things like that, and hopefully we can get more people involved, more people interested in health careers throughout the world and throughout the NHS. I'd also like to give a very, very warm welcome to our many friends around the world, some who are joining us for the first time, and it really shows what a great success Health Careers Live has been over the last few years. I've got one of the Health Careers Live team members who's been with us over the last few years here today to talk a little bit about his experiences, what Health Career Live has meant to him. So with no further ado, I'll welcome my good friend John on.
Hi everyone, it's a pleasure to be here, and I'm very much looking forward to today and tomorrow, where we've got a fantastic lineup of speakers discussing all sorts of topical issues, but also the many types of careers that are available in the NHS. As we have one from today, this morning, over 350 careers, and that's quite a considerable number. Any of those appealing to you? Just go for it. Honestly, go with your gut, do some research online, and see what it's like, get some experience online. So yeah, thank you for having me here today.
And just one question I'd like to ask you, John. What's it been like being part of the HCL team and watching this grow over the last few years?
It's been a very great and rewarding experience, I would say. having been involved for the past number of years. We started off, I think, in real life in Manchester, but then I fully got involved when we started going virtual just before and during the pandemic. And I remember one of the first conferences that I got involved with, we had over 2,500 attendees tuning in from over 74 different countries around the world. We had a fantastic team here working together to have a fantastic lineup of speakers, speaking on all of those different careers that are available: AHP, dentistry, becoming a doctor, nursing, and so much more. We had international speakers and speakers from our supporters from International Collaborative Grand Rounds and Becoming a Doctor. There's been a number of initiatives that we've run, such as the hashtag #MedStudentCovid on Twitter, to help address the number of difficulties and learning experiences that we've developed internationally. This ended up having, I think, over 1.5 million kind of interactions online, and it was one of the highest trending on Twitter at the time in the UK. I've learned a lot myself. The team, I'm sure, has learned a lot, and I'm hoping that you at home are learning a lot.
Thank you very much for that, John. Absolutely inspiring to hear you talk about the journey that you've been on over the last few years with the team here. And also, you know, from us, all of us here at the studio, we'd like to give a massive shout out to the team working behind the scenes today. You know, all the speakers who have agreed to be involved, the months of organizing that some of the team behind the stage have taken part in to make sure that this runs smoothly. They've done an absolutely fantastic job to produce all this for you guys on a free basis. And it really shows how enthusiastic we are about you guys, all of you at home, all over the world, getting involved in health careers and taking your next steps in your journey. Also, a massive shout out to the technical team who are just in the room behind me, who are working tirelessly to make sure everything operates absolutely seamlessly. And to all the support staff, that's the remote staff who are answering your questions, all those who are dealing with our social media, all those who are making sure that everyone is looked after, interacting with the speakers. They've been doing a fantastic job. Okay, next we'd like to move on to one of the behind the scenes to give you guys a bit of an idea of what it takes to run a conference like this.
It's been a brilliant day bringing together so many different organisations, healthcare professionals, students from across the UK and beyond.
It's an amazing opportunity to learn about such a huge range of health careers. We hear a lot about like medicine and dentistry, but we don't often hear as much about the 350 roles within the NHS, and that's something that as a conference we hope to try and challenge, to get people to think beyond the courses that everyone knows about.
There's something for everyone, and it's from like undergraduates for students all the way up until people who are graduating and are working.
We've got AHPs, we've got aspiring medical students, dental students, nursing students, so everyone's represented here.
It is designed to have something for literally anyone. No matter what you're interested in, we will have a talk that covers it.
This is a brilliant programme that brings together so many different professions within the healthcare community, and it's one that should definitely be on everyone's calendar.
So, hello everyone and welcome back. My name is Philippos and I'm the lead for Health Careers Live Europe, one of our latest global ventures aiming to bring together key health workers and thought leaders from across the European continent to share learnings and build partnerships that aspire to a stronger, more diverse and more integrated European healthcare workforce. This will be a rather different session than the ones you've had today and you will attend later today. And I'm very pleased to be joined, to be actually inaugurating the Health Careers Live Europe with a truly inspiring panel of speakers here to talk about their lived experiences of displacement due to conflict in their home countries. A situation unfortunately still faced by many healthcare workers around the globe. The conflict in Ukraine has shaken people all around the world, but it has most importantly impacted those who used to live in a once peaceful country. Today we'll hear from these people, health heroes that have felt the impact of war in their personal and professional lives. We will listen to their stories, their perspectives and their hopes for building back better, stories which might echo the issues that are faced by healthcare workers facing conflict all around the world. So, without further ado, I'll let our wonderful speakers introduce themselves before we move on to discuss some of these key issues. For our viewers, feel free to post any questions that you have in the Q&A section, and we'll try and go through them while we have this discussion. So, please join me in welcoming our fantastic panel of speakers. Over to you guys. Nastya, would you like to start with your introduction? Please go ahead.
Yes, do you hear me right?
Yes, we can hear you.
Yeah, all right. Okay, so I'm a third-year medical student of Lviv National Medical University, and I do study in Lviv. This is the western part of Ukraine. Currently, I'm local coordinator of the Ukrainian part of the project in the Ukrainian part of the PFMSA, International Federation of Medical Student Associations. And this is my pleasure to be here. Thank you for this amazing opportunity to share my experience, because throughout the last few months, like even the half of the year, I've been traveling a lot and I have plenty of things to share. So I'm happy to be here. Thank you.
And Oksana, would you like to go next?
Yes, hello. My name is Oksana from Lviv. I'm an associate professor of pediatrics department number 2, Danilo Halitsky, Lviv National Medical University. At the same time, I am pediatric allergist in Lviv City Children's Hospital. And I am familiar with the problem which has happened in our country, and I can compare how it changed the life of our students, our patients, and our people. So thank you also for this great opportunity to be a part of today's great conference, to speak one another. And with a pleasure, I will share my experience and my everyday practice.
The pleasure is ours to have you guys on the panel today. And lastly, Lolita, would you like to introduce yourself?
Yeah, hello everyone. It's nice to be here with you. I'm Lolita Matyashova, and I was a PhD student in National Institute of Therapy in Kharkiv, and now I change my PhD to Basel. It's in Switzerland, but first 10 days of the war I was in Kharkiv, and we organized a huge help for our patients and for our people, and so Kharkiv from the first day facing troubles like with the war and still, and doctors, my colleague who is still there, some facing. So I really grateful to have this opportunity to share some stories with you.
Well, it's wonderful to meet you, and honestly, thank you for being part of this panel. The pleasure is ours, and the opportunity to have you on this panel today to talk to us about some of these experiences, share some reflections, tell us how that has impacted both your professional and personal lives. It's an opportunity that we here at the Health Careers Live team really value. So thank you for being with us today. So to start with, to set the scene, you've already mentioned some things about how this current situation has impacted you, and you cannot understate the consequences of war in general: death, destruction, displacement, loss of community, just a few of the consequences. And on a more personal level, war can have devastating effects on people's lives, and it would be great to hear what your journey has been like, how the war has impacted you in your clinical practice, in your studies, and how has it impacted you personally. I think our viewers would really like to hear these reflections from you. So whoever wants to go first, please feel free to do so. Nastia, I can see you're having some thoughts you'd like to share. Please feel free.
Okay, thank you so much. All right, so I'm just the youngest here, and probably I do not have so much of experience. I'm still learning, but I do have something that I want to share. So since the beginning of the war, our lives have changed significantly because we couldn't focus on those things that we were focused on, like on self-development or self-improvement, only to study for ourselves and to do all of that. I think that all of us learned to focus more on the society and to help as much as we can, especially as all of us are in the field of medicine. And so did I, even though I was mentally affected, and like nobody knew what to do, because like who expects the war to come to your country? Like never. But when it happens, all you have before is like it's never the same. And I think that personally I have learned how to be stronger and how to do great things. For example, our family decided to escape from the war, and we fled to Israel, and we were there for some time, and I just couldn't focus on my studies. I couldn't do that. I wanted to do something for my country, and that's how I found other students, and we made a collaboration from students of Tel Aviv Medical University and organized the charity event that raised more than $5,000. And I'm not sure if there was no war that I would ever be able to do that, because it gave me strength and belief that I want to do something. And I did that, and that's what I keep doing. So I think that's personally, I was like really morally traumatized, but not that physically as people from the eastern part, but still I learned a lot. So yeah, that's what I face.
That's very inspirational to hear, and I think for someone who hasn't gone through such a situation, I think it takes a lot of reflection to be able to empathize with what you have gone through and how this has impacted you, and some very strong messages that, you know, determination can come out of very difficult situations, and this is certainly what it seems that you have shown through the things you've done. So thank you for that. Would anybody else would like to chip in on some thoughts? We've already sort of touched upon how this has impacted your colleagues, how this has impacted the way you delivered practice, and you know, feel free to sort of pick up from that.
Yeah, I can continue. Mm-hmm. I will start, I want to share experience about the first 10 days, because Kharkiv, it was one of the first who faced it. And everyone in Ukraine, all of us woke up at 5 a.m. on these days. And I remember before the day we left from the work, we had a lot of patients in the hospital. Some doctors were stayed for the shift and so on. And everyone went home. And then when everything started, we face that we can't go to the hospital because in Kharkiv, the main public transport is subway. And from the first time, from the 5 a.m., the subway stopped and it started to be like a shelling. So it was difficult to move in and so on. So as a result, doctors couldn't go to the work. Doctors who were at hospital and who weren't prepared to stay like 3-4 days in the hospital, they stuck there. The patients who needed help, they couldn't go to the hospital. So it said to be a huge problem, and we saw it. And my institution started like initiative in Kharkiv. We collected our all phone numbers and we put it like in our social media, in our Kharkiv regional site, for that people can't call us like for consultation and so on, because we haven't like a choice. We couldn't like go even to like polyclinics or somewhere. And everyone for us started receiving calls. So at least somehow we couldn't help people. We also, I received personally calls from Kyiv, also from Bucha, from Irpin, when it was like still connection. And sometimes it was like woman, like I remember this call like from a woman, like she called me like from Irpin and said like, I have like 1 month year baby, and now I think like I have like tonsillitis or something. I have like a huge temperature because always like all time was spending in their basement. So and it's like I have like some antibiotics, I'm not sure, and it's like by phone, like it's like you can't like even call her like with video because the connection really bad. So it was like a lot of problems which we faced and which we somehow could like possibly to like figure out and so on. And like I think from this point we learn a lot, and somehow like people said to help each other and like find new way. And also for me personally, I like with my friends around the world, we started to write in articles, like we started like to make this story bigger. So, and I'm really glad and grateful that it's still continue, because we still suffering a lot of problems and we still need help and need to continue to telling our stories. And it's like good that now today we're all here to continue this journey. Thank you.
And it's certainly a great pleasure and a great privilege to be able to hear these stories and to be here to echo these messages and to tell the stories of how you've been able to adapt to a very harsh reality, how you've been able to make the best out of a situation, to keep your commitment to your patients and deliver the care that has to be delivered. The health needs haven't stopped being there, they've actually increased, and this is something that we sort of move on to discuss later. But before we do that, I'd like to hear some final reflections from our latest panelist, Oksana, if you'd like to add anything to that.
Yes, first of all, I want to tell you that by 24th of February, we lived in a peaceful country, and we couldn't even imagine that war can be present in 21st century. Yes, we have read this information that war can be possible, but anybody couldn't believe in this situation. And when I woke up in the morning and when I got this information from TV that it's really now the war become reality, first it was a shock information, and we couldn't know what we have to do. How can we stay in our country? It was, we analyzed, is it safety for our children, for our family? And at this moment, I think that we start to help one another to support. And for example, I am living in the western part in Ukraine, and at this moment it was, and now it's more safety region than another cities in Ukraine. And we try to help. So we were not on this active zone of the war, and we try to help in other regions. First of all, I'm like a teacher. I had my working day to study students, foreign students at the university, and they call me in the morning that they move they are looking for possibility to leave our country, and some of them moved to Kiev and they were blocked there, and others moved to Polish. And I received a lot of calls from my foreign students. They were in a panic. They asked me about information. For example, what shelters are present in Kiev, and I was looking in internet, and we share this information to save them. So it was a very, very difficult time for them, and we organized a chat with our teachers at the university, and we share this information to support our foreign colleagues. And practically during first 2 days, they leave our country. Another problem which was present in Lviv and in our western part, that many people move from another eastern part and central part of Ukraine who plan to move from Ukraine. And I saw how many mothers and their children were waiting on the border to leave our country, and some of them were waiting for 4 days. And some friends, which I know, some of my friends, were waiting there without any meal. They don't plan to stay so long time, and their 2, 4, 3 years old children were at the car without any drinks or food. And I want to say that people who live near the border of Poland, they help very much. They prepare hot dishes for them. I know many people who were volunteers at this time, and they bring snacks for these children. They bring clothes for them. And I think that at this time, it was difficult for everyone. It was different. It was difficult in different positions, but we accumulate our forces. We help one another, and many people abroad also support Ukraine. And after this first or 2 days of shock, we got a big help from another countries, and it helped us to understand that we will have opportunity to help one another, and other people support, and all civilian world support our country. As a doctor, I also had many complicated cases with patients who couldn't stay in our country because at this moment it was dangerous to stay. When we have an alarm ring, we have to move to the shelter, and it was very difficult with our patients who have severe disorders. We try to give our consultation online for patients who have mild or moderate courses of the disease, but who really need surgery or who really need another more complicated disorder and who need to be followed up by doctor. They stay in the hospital, and at this moment we receive many help from volunteers from another countries because we double our equipment. For example, in intensive care department, We have equipment for acute pulmonary ventilation, for CPAP, another type of oxygen therapy, incubator for newborns baby. And we, in first 10 days, we double all equipment in our shelter. And in our country, the hospital in Lviv, we had many patients. Some of them moved from another part of Ukraine to stay here, but some of them stay like transit and move to another countries. So it was really difficult situation. But at this situation, we become more strong. We are sure, we believe that in this war, we win because we didn't plan any situation. We don't want anything from Russia, for example. We only want to save our country, to save our people, and to live in an independent country.
Some very powerful words from you, and what you said in the beginning, that you never thought that this would ever come to your country. I think this is probably the situation for a lot of people who have faced conflict in their lives, and it's certainly something that the people who had been following the news that morning, where they read the headline, most of them couldn't believe it. So I think most people won't forget the day that they heard that this is happening. And I sort of echo the thought around how such a situation, despite how devastating, despite how difficult it is, how destructive it has been, it's been met with a response that's brought people together, that's made people work together to deliver amazing things, some of the things that you've mentioned yourselves, and is inspiring the way we can support healthcare workers that are displaced in the future. And that's actually something that I want to sort of move on from and stay on that thought and ask you what you've felt has been the support that healthcare workers fleeing countries such as Ukraine have received across Europe, across the UK. The NHS here has, for example, granted free access to healthcare for all of those who've come from Ukraine, seeing it as a moral imperative really to support those displaced. And we can talk more generally about how do we support healthcare workers that are displaced due to conflict, because this is not something we've seen for the first time. It's something that's come to our doorsteps and has really reminded us that conflict is all around us. This is happening en masse everywhere, but now it's reminding us that we need to do something about it, and we need to support countries like Ukraine. So feel free to share any thoughts on how we can best support displaced workers.
All right, so, okay, I can start?
Mm-hmm. Go ahead, please.
Okay, I just saw that, yeah, I just saw that Oksana's microphone is on. All right. So what I wanted to share is, again, from the student's perspective, I think, because I'm still, like, even though I mentioned that I couldn't focus on my studying so much because of the war. Now, we still want to be doctors, and we want to become great professionals, and we want to get the best knowledge that is possible to get. And with the current situation, it has become really hard. So now it becomes better, but still at that point, it was my fourth semester. So second year, fourth semester, it was terrible, I would say. So what I was looking for, and I know a lot of students were looking for, some programs, scholarships, then some resources. And we're so grateful that UK medical schools have posted a lot of materials online, like explanation, lectures, all of that was accessible, and we're grateful for that. But still talking about, I know that the question was about displaced workers, but what about displaced students? I know a lot of them who are struggling to enter the medical system in UK, even though there is a lot of support, but still lack of knowledge and completely different systems. It makes it really, really hard to even understand what are those systems like A levels or whatever that's. There is some information about it on the internet, but if there were some generalized structures or some particular people who could help students, for example, to assist them with all the questions they have, that would be really, really helpful for them. And I think this way it would be easier, at least for our students, to get, for example, their scholarship and to go there to see how it is going on, to learn something and to go back. Because like me being a medical student, and I know a lot of other students who are like going from one country to the other country, and then they get the best knowledge that is possible and come back and then do something for their country. And that's what we're trying to do. And when other countries help us, as the UK countries, when they do support us and help us with that, it makes our so-called mission easier. So yeah, that's what I wanted to say. Thank you.
I think from what I take from this as a key learning point is that there's been stuff that's been done to support students like yourself, and I can imagine what it must have been like having to travel around, not really having a place, having to do everything online. I believe you're still studying online, which in itself, a medical course it's challenging to do it online, not to be there with patients, not to be practicing those skills that you need in your day-to-day work. We do need to do more to support transitions. We do need to do more to inform people as to how we can potentially sort of standardize the way we teach our medical students in medical school, because I understand that this has been the challenge across different educational systems that have used different standards and don't really communicate. So it's a very, very important point you raise, and thank you for that. Do any of the doctors in our group like to share how they felt, what opportunities they felt they had once the conflict broke out, and how they felt they were met in Europe and across the world?
Yeah, if I may, I will continue. So yeah, first, let's say what was done, and actually a lot of things was done. So at first, all Ukrainian people, they receive free medical care in all Europe, which was a huge help. Then immediately after few days when the war started, all Europe started to announce different scholarship, different observation opportunities to research for doctors, for different specialty. And in Wien, in Germany, you can found easily for at least 4 months observation for doctors. And I can say also about Switzerland, what they did. They announced for 1 year scholarship, scholar at risk, and for doctors, for scientists, and especially me, I apply for a science program because since in Kharkiv we have also a problem with electricity because of the shelling. My blood samplings from my PhD, it was totally destroyed, and I can't continue, and I can't collect a new one. So I wrote to professor, I wrote for this scholarship, I got my position, and I could continue work. Then I had possibility to apply also for a PhD. So also I know another doctors from Ukraine. who now first they starting take like observership in Switzerland, and now they started to work. And like till now, Switzerland continue to support Ukrainian doctors, Ukrainian scientists in medical field, and medical student. They can go for 1 year visiting program and have scholarship and like have degree. So like it was a lot of help. And especially for me, which like could be done more, like if more country would like announce this 1 year program, because when I was looking, when it's like 4 months, it's more difficult because you don't know what will be next, and like 4 months, it's not the stability which you're looking for. And also, we found a lot of doctors from Europe. They said to be open for online consultation and for consultation with doctors. And if we can continue this, when Ukrainian doctors, can call like with like telemedicine with video and like ask help, it will be really, really good. I think from my perspective.
Well, it's certainly very, very nice to hear that your experience has been a very positive one in terms of the response and the way that you felt supported from people in other European countries, the fact that you've been able to continue what you were doing and continue and start your PhD in Switzerland. That's fantastic. But as you say, there's still room to do more, and I think some of the things you talked to us about today have really sort of echoed what still needs to be done, and it's honestly a pleasure to be hearing these things right from the source from you guys. Any final reflections from Oksana on the topic before we move on?
Yes. Thank you. So from my experience, the war gave us a lot of challenges, but at the same time, with the support of another people, we receive many possibilities. And I also want to classify these possibilities for example, for students, they have support in countries who are our neighbors. For example, at the university in Lviv, which is more safety region from another parts of Ukraine, about 25% of foreign students move from our university to Poland, to Slovakia, and these countries give a chance for the students to proceed with their study. So they didn't start like on the first course, they proceed their study in another universities. For our students, for Ukrainian students who are in Ukraine, we have a lot of materials for free from another European countries. We have a platform, different scientific platform, where we can share information from different nosologists, from different subjects, and it's a great support for us to study, to develop our knowledge, and to go in one way with another students who study medicine in another countries. When we are speaking about patients, many patients with oncohematologist, with another chronic disorders move to specialistic centers in other countries, and we help with translation of their history cases. For example, I was working with grants from Germany and from France and from Poland. And I received information. I was like coordinator between patients and between people who are ready to take different patients with different nosologists for treatment. And we coordinate these patients. For example, many patients with severe neurological problems moved to Germany. They received the surgery there and rehabilitation. A lot of patients with oncohematologists moved to a Polish clinic. And we really appreciate for this possibility to help these people, because they cannot receive this treatment in our country now because of lack of electricity, because of lack of drugs, and because of dangerous situation. Another what I want to tell you is that we receive a great support with drugs for our partners, for example, from different associations. First days of the war, we received a lot of humanitarian help, which is in direct action on the front line. It was different hemostatic, it was different surgical equipment which was transferred on the front line at this moment. Then we start. It was the drugs come to our country, but there was like mixed different groups: antibiotics, inhalations, surgical, and some drugs were in lack, and other were, for example, another drugs were too much. We start to share these drugs with another doctors from another clinic. And then we start to work with associations. For example, we had doctors who are cardiologists, and they spread their experience, they declare what they need for first line in treatment, and they receive these specific drugs or specific equipment from specialists of the same line. I, like a pediatrician and allergist, I receive a lot of help from our Italian partners and from France. And we share, we can give these drugs for our patients and for refugees who move from another countries. We can give it when it was absent at pharmacy, or we can give it for free. And it's a great support at this moment for our patient. So summarizing, I want to say that we accumulate our force in different directions. And it was not only our general job. So I started to do a lot of work which I was not familiar before, which was not my basic work, but we couldn't be passive. And I was surprised when I received a lot of calls from my friends, from my relatives, from my even not my friends, but friends of my friends that they want to help, these people who were known for me before come to the clinic. They help to prepare shelters. They help with different drugs. They help with to help people move from another region from one region to another. At this very difficult situation, we received a huge help from one another and from another people abroad. It's my experience at this moment.
I think your reflections really show that apart from just supporting displaced workers, supporting the people who are in the front lines who are delivering the care, we're also talking about supporting healthcare systems in ways that are meaningful with devices, with medicines, with meeting the needs that arise from such a situation. And it's truly inspiring to hear just what a massive response, what a massive mobilization, how we've brought together people of all different nationalities, not only Ukrainians, but people from Europe, people from all over the world wanting to chip in and help. I think there are a lot of learnings that we should take from this and generalize to how we deal with anyone who who deals with such a horrible situation, who deals with conflict in their own home country. So having talked about all of this and having reflected a lot on some of the things you've said, I'd sort of want to end on a different note and ask you, despite all the difficulties that you face, despite all the problems that the situation has created, what opportunities do you see for yourself in the future? What opportunities do you see for the healthcare workforce as a whole? And what message would you send to anyone who is facing such a similar situation of conflict and is trying to get through their clinical training, is trying to get through their medical school, is trying to get into healthcare and start their training? Because as an organization, this is what we've been founded on, this is what we've mostly sort of occupied ourselves with, and it's a real privilege to extend that to something much more meaningful, much more powerful with having you on board here today. So I'd like to hear some final thoughts from you on these points.
All right, so I think that my main message would be to be brave, and the words that you mentioned today was determination, and I would rather emphasize on this word, because you need to believe in yourselves, and that you can do whatever is important to you. You can meet other people, you can explain them what you want to do, and you can do it all together, and it works, because this is how this world works. And this is the most significant thing that I've understood throughout these months, that we're able to do whatever we want if we believe in that, and if we can make other people believe in that. But the first thing is like to believe in yourself, right? So you can prepare for that exam, you can get that scholarship, you can enter that medical school, you can organize a charity event, you can do whatever you want. It only depends on you. So this is my message. So no external circumstances, no wars, no conflicts. Even if everything is bad, you can always find positive things about it. You can always learn something and keep working on yourself. So yeah, that's what I wanted to say.
Anyone else, please feel free to share some reflections.
Yeah, if you like, I will continue. So for me, as you know, like the last 5 years, Ukraine trying to rebuild a medical system. And now I think we have a great opportunity when a lot of specialists in Europe, some in USA and so on. So every one of us can learn something the best from every system and came back and rebuilt it and made it's perfect, not perfect, but really good, So, and my message for everyone who struggles the same, what we go through, what we went, I'm just want to say you keep going, no matter what, keep going, and you're not alone. Here are a lot of people who is ready to be with you, near you, support you, and always give your shoulder, their shoulder to help you. So just keep going, and yeah, everything will be okay.
I think I have to sort of repeat that message. You're not alone. I think that's a very inspirational quote to have in the back of our minds, and it's truly sort of phenomenal to hear this from people like you who faced challenges that most of us have never even imagined would have to go through. So Oksana, if you'd like to share a couple of thoughts for a minute or so before we close off, that would be great.
I'm sorry, I had bad connection. Can you repeat your question?
So we're just talking about reflections on
yes, about reflections.
What opportunities do you see for yourself in the future, and what would you say to someone who's going through a similar tough situation, is facing conflict in their home country and is trying to go through clinical training, is trying to get into medical school, is trying to finish their medical studies, clearly aligned with our mission at Health Careers Live?
So my message at this situation is that we have to do the best on our working place. So everyone has to do everything which he can do at this moment, and at this place, at this country. Many people move now to another countries and stay there for the moment when we have this active war. But they can help distance. They organize different volunteers help. They help with money, financial support. We understand that when you are alone, you cannot get any result. So our force is to be together one with another and with another countries. And I think that in this situation, everyone can find and everyone changed his life. We will never be the same like we were before. That is why in this situation we have we have the only we are dreaming. Our dream is the one for everyone now. That is why we have to do the best, and I really believe that together we will win, and I hope that it will be in soon future.
I honestly am very glad that we've finished on a very, very positive note, and the energy that you've given out and the reflections that you've shared have really echoed that. It speaks to the strength, the commitment, the determination that we mentioned before, that you have shown, that a lot of people who have faced such difficult situations end up having to just come up with it. You know, it's never something you can really prepare for. It's just when you're put on the spot, that's when you have to respond to a situation in the best possible way. And from everything I've heard from you today, it seems that you've done incredibly well in that respect, and it was really a pleasure to hear your stories and to hear your reflections. And I'm sure that our viewers would probably have had a lot of thoughts. They might have had some reflections. I understand that some of these topics might be difficult for some people, and I would like to invite them to share some reflections that they have, to write some thoughts that were generated from this discussion. Please feel free to do so at the chat. We would love to hear what you've thought. And thank you again for the panelists. You've been amazing. It was a real pleasure to have you here. I hope you enjoyed it, and have a good rest of your day.
Thank you so much.
Thank you so much.
Mitch Reedhead, so Health Careers Live.
Here we are live in Manchester, the great Manchester, where the National Health Service was born, in Trafford. And who do we have here?
Blair.
Tony Blair. It's a lovely,
Close
lovely
enough.
day. So Blair, why do we need a National Health Service?
In order to support all of those across the nation that need health services.
And do you think the pandemic has brought us closer together as a world?
No, not at all.
And that's why it's so great to have you as an ambassador at Health Careers Live. Together we're supporting global health systems to learn together, to share their knowledge and to support every single migrant in the world, because we're all migrants, that's all we've ever been. When I go to Liverpool, I've got a Scouse accent. When I go to Manchester, I'm too Londoner. You know, you can go on and on. Yeah. Right, let's hear those tunes, one sec. Sorry. You shouldn't be a drummer, you get distracted with background noise. So, we're going to see you at the National Health Careers Conference.
What a fantastic presentation and session we've had from the team just before us. Some truly inspiring stories and some great inspiration for all of us moving forward. At this point, we'd like to move on to the next session of the afternoon. And it's my great honour to introduce the next speaker, who is Andrew Ferber, OBE. So Andrew has been Regional Director for Public Health England and Regional Director for the North West since May 2020. He was previously Centre Director for Public Health England in Yorkshire and Humber. He originally trained as a GP and is now a public health specialist with international experience. He's worked for 7 years in Nepal at all levels of the health system over there, working on some short and long-term projects over there. And in the UK, he's worked as a public health director from 2007 all the way up to 2018. And he's previously been president of the Association of Directors of Public Health. So truly a well-accomplished man. Really, really fantastic. Andrew is so well accomplished actually that he was awarded an OBE in May 2022. So once again, it's my great honor to have him here today and have him on the program speaking. As a public health trainee myself, Andrew is not only an inspiration, but it's also my boss's boss's boss. So he's a true role model, and I hope to one day be able to achieve some of the things that he's achieved in his career and use him as the foundation to follow moving forward. Today, Andrew is here to talk to us about his journey through public health, the role public health plays in modern times, how people just like yourself can make a difference, and some of the career opportunities available to all of you sitting at home. Without any further ado, please welcome Andrew onto the stage.
Thank you. Yeah, it's good to be here today.
So how's it going, Andrew? And how are you feeling?
Yeah, no, I'm good, thank you. I'm looking forward to the weekend. It's been a busy week. It feels like autumn's arrived in the north of England. Looking forward to getting out and about in the weather.
That's definitely correct. The weather has not been beautiful where we are at the moment, but hopefully it doesn't last too much longer. We're very excited to hear you speak today, and I'm sure all those at home have been waiting eagerly for this session. So whenever you're ready, feel welcome to take it away.
Okay, thanks very much, Yaz. Can I just start by saying I really appreciate being invited to this event today. I think it's just fabulous what you're doing. We need to do so much more to improve access to medicine and other healthcare professions to ensure that those coming into the profession better reflect the communities that we serve. There are far too many underrepresented groups that are not represented in medicine and other healthcare professions. So I just love what this conference is doing and what work is going on more broadly to try and improve access. And if you're kind of listening in today and just kind of wondering whether you've got what it takes, if you feel passionate about a career in medicine or a healthcare profession, then my advice to you is to go for it, follow your heart. And if you've got the passion and you're prepared to work hard, you will make it. But following Yaz's very kind introduction, I do just want to talk a little bit about public health, and in particular how you can make a difference to a fairer, more equal and healthier world. I hope at the end of this, a better understanding of what public health is, and an understanding of public health careers. And if you don't think a public health career is for you, how you can make a difference to see a fairer, more equal and healthier world in whatever part of the healthcare system you end up in. But I wanted to start just by telling you a little bit about my story and my journey. So I went to Newcastle Medical School, was there for 5 years. To be honest, I'm not really quite sure I knew what I was letting myself in for. I was kind of good at sciencey things at school. I wanted to do a degree that was kind of more vocational than theoretical, and I had the grades for medical school, so I kind of went for it. It's kind of not the motivation I would recommend, or probably not the motivation that would get you in these days, but it's what got me to Newcastle. And through my 5 years there, I kind of really enjoyed everything and all the specialties that I passed through. So at the end, I decided to do general practice because I felt that kind of gave me a little bit of everything. I could do some pediatrics and long-term condition management, dermatology, obstetrics. You could do a little bit of everything. So that's what I started to do. But I did have a hankering to do something different while I was still young and still able. So at the end, or actually in the middle of my GP training program, I took 6 months to go and work in Nepal. And the picture you can see at the top right of the screen is actually Mount Everest. The peak at the top there in the middle is Mount Everest. And I spent 6 months in Okaldunga district, which is the district to the south of Solukhumbu district, which is where Mount Everest is. And I was there at a district hospital, covering between one long-term doctor leaving and the next long-term doctor arriving. And it was a real life-changing 6 months, a real career-changing 6 months for me. And I want to tell you about one individual in particular who I met there. It was a young lad called Sham. Must have been 10, 11 years old. And even though I was a relatively junior doctor, as soon as he walked into the clinic, I could see immediately he had what we call Pott's spine. So this is a deformity of the spine that's very often caused by tuberculosis. And we got the test done and confirmed that tuberculosis was the likely treatment. Now, the treatment for tuberculosis that we were using at the time involved an injection and some tablets, and we would normally teach the family how to give the injection and instruct them on how to give the tablets and send them back home to continue the treatment. If patients needed admitting to hospital, there were costs involved. Patients had to pay for, contribution at least towards some of the food, for example. It's not like the NHS where everything is free at the point of need. In situations like Nepal, these things have to be paid for in some way. So people usually prefer to go home and take the treatment at home. But anyway, this lad's father was absolutely insistent that he was admitted, absolutely refused to take him home. And so after some discussion, we agreed to admit him. And he was with us for about a month. And during that month, we got to know more about his story. And it turns out that this lad came from a village about 2 days' walk away from the hospital. There were no motorable roads in the time in the district. People just had to walk to the hospital if they wanted to come. No ambulances. People had to be carried. So he'd been carried for the 2 days to get to the hospital. And it turned out his village was a very small one, just consisting of 3 households. The father of this boy and his 2 brothers, so his 2 uncles, if you like. And the father told us that over the last couple of years, one by one, members of this small village were succumbing to a disease that was characterized by a cough, a chronic cough, night sweats, losing weight, and one by one, unfortunately, these villagers were dying. Now, I don't know how familiar you are with medicine, but those, at least with a bit of training, would recognize those as the very classical symptoms of tuberculosis. But they didn't know what was going on. That they consulted the local healer, the Dharmi Jankri, as it would be called in Nepali, and asked for his advice. And he kind of went through the rituals and sacrifices and what have you, and clearly those things didn't work. Now, I want to make it clear I'm not dismissing the role of traditional healers, and in another role in Nepal, I spent a bit of time training and working with these people, because they are the eyes and ears out in the villages and are well placed to spot signs of serious illness. But on this occasion, he didn't recognize that this was the serious illness that required treatment. And in fact, when this little boy became ill, he told the father, if you take the boy to a hospital, he will surely die. But the lad's father thought, well, the rest of my family have died. My wife's died, my brothers have died. I've got nothing to lose. So he took him to hospital. We diagnosed him with TB and started him on treatment, and he responded very well. But the village was not only remote, there were not only no other health services there, the family were subsistence farmers, so very, very poor, just relying on what they could grow within the land that they had available. That they were illiterate, so they couldn't kind of read and write. So even if there was sort of health information around, they couldn't have accessed it very easily. So I reflected on this and kind of had a light bulb moment that although tuberculosis had been the immediate cause of this lad's predicament, there were some causes of that cause, and it was the inaccessibility of the village. It was the remoteness of health services. It was the fact that the family were illiterate, that they were living pretty much near the poverty line. They didn't have the resources in order to access the help that they needed. So that made me think that, these things are really important in terms of health and well-being, really important in terms of improving the health of communities. So I finished my 6 months there and came back to work in Newcastle, and I was just kind of reminded by that experience of another woman that I'd seen in working in Newcastle, actually when I was a house officer at Newcastle General Hospital, which was known at the time as the workhouse, because it was previously a workhouse in Victorian times. Thoroughly modernised now and quite different to how it was then, but it still had that kind of Victorian feel. And I remember looking after this woman called Margaret, and she was in her 60s, and she had end-stage chronic obstructive lung disease. And I was called to see her in the middle of the night, and just sat with her and held her hand as she literally breathed her last. Now, a 60-year-old is not old, and certainly not an age you should be dying of chronic lung disease. But this had been caused by the fact that Margaret had been a smoker for more than 40 years. But again, as I kind of thought about Margaret's story, she hadn't come from the well-to-do part of Newcastle. She came from the west end of Newcastle, the poorer part. She hadn't completed education at school. She didn't have a good job. She came from a society where smoking was the norm. In her community, the majority of adults would have been smokers when she started smoking. So again, that kind of realization that prevention was much better than cure, but prevention required us to address some of those determinants of, in this case, smoking behavior, those determinants of ill health. So that's what got me into public health, those kind of two light bulb experiences where you realize that there's only so much you can do by providing treatment, particularly towards the end stage of a disease process, and how much better it is to act early and prevent illness from happening in the first place. But in order to do that, we need to influence the conditions in which people live. So public health then is defined as that science and art of preventing disease, prolonging life, and promoting health and well-being through the organised efforts of society. But there is a science to it. There is an evidence base, a robust evidence base around the interventions that we try to put in place. But because it does require the organised efforts of society, there's an art to it as well. There's a kind of a leadership that's required if we're to make these things happen and to make a difference. It is a very broad agenda. That's one of the things I love about it. You can be dealing with everything from tobacco to transport, children's health to climate change, violence to viruses, pretty much anything which directly and indirectly impacts on people's health and well-being. Viruses, of course, in the news over the last 2-3 years when we've been dealing with the COVID response, and we can talk a bit more about that later if people are interested in hearing more about that. But a simple way to think about it is that clinical interventions really relate to individuals. It's if you give somebody treatment for high blood pressure, for example, or diabetes, that's an individual level clinical intervention. Public health interventions can be thought about things which apply to populations, to groups of people rather than individuals. So that's public health, but I think it's really important that I just spend a few moments focusing on health inequalities, because we know that everybody does not enjoy the same level of health. There are these unfair and avoidable differences in people's health across the population and between specific groups. Now, I've just put a few figures down here. There's lots more that I could have put up there, but they are sobering, I would suggest. So if you are homeless and living on the street, your life expectancy is roughly half what it would be for somebody that's in a housing situation. That's I think that's quite shocking. If you live in one of the more deprived areas, so I cover the northwest. If you're a woman in Blackpool, your healthy life expectancy is just barely 50 years. So you don't even reach retirement age before you start developing ill health and conditions which affect your life expectancy. In the most affluent parts of the country, that is 70 years. So a 20-year difference in healthy life expectancy depending on where you live. Asylum seekers, similarly, poor health. Those coming from certain ethnic groups similarly suffer poor health. Back to COVID again, COVID deaths in black men were considerably higher than those in white men during the first wave of COVID-19, and understanding those differences really important in terms of the response. And those with serious mental illness, 390% excess mortality compared to the average. So, really quite stark differences in people's health that it is important that we understand, because that then will need to guide the interventions that we put in place. Now, there's a bigger picture to all this, of course. So I felt it would be remiss if I didn't pick up on this, because I think this is really topical and going to be really important in terms of your careers, wherever you end up. So this is a graphic just to try and explain that. So the smallest box there perhaps represents individual clinical interventions. The next circle out is public health, so that's at community level, population level. That's what I've just been trying to explain. Global health could be thought about those public health interventions in an international context where people face perhaps different barriers to achieving good health. One health can be thought about as not only human health, but also animal health and the sort of biosystem in which we live. And we know that increasingly we're seeing viruses that are hosted within pigs or chickens or whatever, and find some way of transferring to humans. And every now and again, one of those viruses will be able to replicate within humans, be transmitted between humans, and cause severe disease. And that's inevitably going to happen. So we will see another pandemic that takes that kind of route at some point. At the moment, none of us know quite where or how or when, but it will come at some point. So important that we understand that kind of One Health dynamic, not just thinking about human health, but also thinking about animal health. And then the biggest circle, of course, is planetary health, thinking about the environment in which we live and climate change. The figures today have been produced on the excess deaths that we saw during the heat wave in the summer. Nearly 3,000 people over the age of 65 died unexpectedly, above what we would have expected during the summer because of that hot weather. This winter, every winter we see excess mortality related to the cold weather, and this winter in particular, when people are worried about the cost of living and the cost of fuel and whether they can heat their houses, the real concern that we might see excess mortality associated with that. So really important that as public health people, we think about planetary health and the changes to our climate. Now, I'll talk in a minute about specialist public health training and specialist public health roles. But public health, I think, is something that every healthcare worker should be doing. Really important that everybody, I think, has an understanding of public health, because there aren't many public health specialists, frankly, and we cannot do everything. We need everybody contributing to making that fairer, equal, and healthier world. So it may be things about health protection that you can do, encouraging people to get immunized, for example, or practicing good hygiene, infection control measures to limit the spread of infection. There might be things that you can do to prevent illness from happening, falls prevention, public access defibrillators, being competent in basic cardiopulmonary resuscitation. Just some examples there. Or promoting good health. Promoting healthy behaviors, thinking about the well-being of your team and your staff. Making every contact count is a specific program which trains healthcare workers, and in fact anybody coming into contact with members of the public, to know how to go about having conversations around alcohol consumption, for example, or stopping smoking. Running health campaigns, or advising people on how they might stop smoking. Something that everybody can do. You don't need to be trained in public health to do these things. There is the potential to do more, though, and we need to make sure that our workforce in the NHS and the care system kind of understand the potential that they have to make these sort of interventions in the lives of their clients and residents and patients. But public health careers then, this is my final slide, and so it's a slightly fuzzy, so I'll just kind of talk through it a little bit. So the inner circle there just talks about public health careers and 4 domains in which people commonly work. So at the bottom there, there's academic public health. So you can train up through various fellowships and get the kind of research degrees that are required, the PhDs that are required for a career in academic public health, and that's a really important role in terms of generating some of that evidence, some of that science that I spoke about earlier that then informs our public health practice. So there's academic public health roles. In the yellow there's health protection roles. Now in England, health protection is delivered by the UK Health Security Agency, which is a new agency specifically devoted to delivering on the health protection function, which is around communicable disease control principally, but also looking at environmental hazards and making sure that the population is safe from that. At the top, kind of orangey block there is around health improvement, and I'm now employed by the Office for Health Improvement and Disparities within the Department of Health and Social Care, which is taking forward that health improvement agenda, supporting people to be smoke-free, to understand better their alcohol consumption, how to be more physically active, how to eat more healthily, and so on. And then finally, healthcare public health. So I also have a joint role with NHS England in the Northwest, and I have a team within NHS England in the Northwest that looks at effective public health services, screening and immunisation services are within the NHS in England, and dental public health is also one of the functions. So we advise the NHS on the evidence around effective and efficient interventions. I'm the Senior Responsible Officer in the Northwest for our Inequalities Programme within the NHS, which includes the role of the NHS organisations as anchor institutions. So these are, you know, NHS hospitals, as you will understand, are big employers within the local area, and if they're recruiting from the local population in an equitable way, that's a real contribution to improving health in the long term. If they're procuring services from local providers that are paying a fair wage, again, that's another way in which they can contribute. So inequalities, I'm also the responsible officer for their prevention work and also for their work around the greener NHS, so helping the NHS to become more or less carbon emitting to reach net zero. In line with the ambitions that the NHS have. So those are the kind of 4 domains in which people can work. Now, if you're in England and working within the local authority team, which is where directors of public health are appointed, you'll probably be covering 3, if not 4 of those roles. That you will have a health protection remit, so you'll be doing things around improving health. You'll be liaising with the NHS locally, as well as very probably with your local academic public health department. Now, within those domains, you can kind of choose where you want to work. So the purple line on that kind of rainbow there is around the life course. So some people choose to do health improvement roles that focus on children and young people and those kind of early years. Other people choose healthcare public health roles that focus on perhaps older people and aging healthily. So within each of those domains, there's a possibility to kind of think about particular segments of the population. And then on the outside, again, there's those kind of determinants of health. So from the left, genetics there. So there is a a kind of subspecialty of public health genetics, just trying to understand how genetics affects the health of the population, access to healthcare, healthy and sustainable places, health behaviours, and social and economic factors. So a public health career offers the opportunity to work on those kind of issues, all with the aim of improving public health, the health of the population. Now, I've put some links there, which I'm more than happy for these slides to be shared. You can click on the links and go through to those sites for further information. But actually, if you just go and look on the Faculty of Public Health website, they have a tab on careers in public health, and a lot of detail there on how you can get into public health careers. If you think that specialty training is for you, by specialty training I mean that after you've done your foundation training, you can train as a specialist in public health in the way that others might train as a pediatrician or a surgeon. It's the same 5-year, quite rigorous training program with postgraduate exams and so on. Public health specialty training differs from those other medical specialties, though, by being open to people that come up through other routes. And this is one of the things I love about public health. You get to work with people that come from other disciplines. So you may have come up through a nursing route, allied health professional, other kind of healthcare route. Or you may have come up through a completely different route, maybe been a geographer or a statistician or a journalist even, and all these skills really contribute, because if you're a statistician, that really helps to understand the data and the intelligence. If you're a journalist, that gives you great skills around how to communicate better with the population. So it's that richness of those that work in public health that I really enjoy. But more information on specialty training through the faculty website. It is very competitive. There are about 10 applications for every place, and that makes it one of the most competitive of the postgraduate specialty training programs. I think things like cardiothoracic surgery and neurosurgery might have a higher ratio, but that's because they have very few places. But as I said before, if you're passionate about it, don't let that put you off. If you think this is for you, or you've got the heart for it, then go for it. But I think wherever you end up, I think it's well worth understanding some of these public health concepts and how you can contribute in whatever you are doing towards that fairer, more equal and healthier world. And I put a link down there, All Our Health. And it may be that you're, not yet embarked on your career, not quite sure what to do. Then this is a learning resource that you can kind of dip into. You have to register, but it's completely free. And you can go in there. There's all sorts of modules on, how you go around supporting somebody to stop smoking. There are things in there on climate change now, kind of roll in that. So all sorts of things, safeguarding, some really important concepts that it's important that everybody knows about. So that's well worth having a look about if you're thinking about getting into one of these professions. It's good to go and explore that, so you become familiar with some of the concepts and some of the ideas that would go down very well at interview. I would suggest if you can demonstrate that you've done some of that prior learning. If you're in training at the minute and kind of exploring what sort of future career you might want, then again, just having a look around there and seeing what catches your eye and what interests you there. If you're already in a profession but just want to kind of broaden your thinking and competence around some of these issues, then there will be things in there for you. So I do highly commend that to you. So yes, that was all I was going to say. Thank you very much for listening to me today, and welcome any questions.
Thank you very much, Andrew. I hope you can hear me where you are. That was an absolutely fantastic presentation. Thank you so much for such a personal account of your own experiences, and also that really great overview of the role of public health in modern times. I'm sure many people at home who may have just heard about public health during COVID, but didn't really understand the role that it played and the true span of community that it covers, may now have a better understanding. And as well, talking about your global experiences as well, to show, as you mentioned, that there is really just one health. So a question that we've got for you here, Andrew, is there is a cost of living crisis coming up in the near future. What role does public health play in that?
Yeah, a huge role actually, and we've been doing a lot of work with our Director of Public Health in the Northwest on this at the minute. So it's a number of levels. So understanding the data and the intelligence on this. So some of our analysts have been looking at the housing stock in the Northwest and which households might be more vulnerable to the fuel cost increases that we're seeing at the minute, how that then correlates with what we know about people's income, what we know about poor health in these communities. So using that intelligence and that data to enable then local services to be able to target communities with support and with help. I've got somebody at the minute doing a bit of work around food insecurity. Again, just trying to understand what is the evidence base about how we can support people that might be struggling to find the money that they need to eat well during the winter. And also to do that in a culturally appropriate way, just kind of understanding the kind of food requirements of different populations within the Northwest. So again, kind of just thinking about that kind of from an inequalities angle as well. Working with our colleagues in the NHS around what this cost of living emergency might have implications for them in terms of their own staff and their own workforce, but also and most importantly the people that they're supporting and caring for how can they better understand how to signpost people to other sources of help that's out there. So an awful lot of work going on at the minute, Yaz, around planning for winter, which we do every year, but this year particularly focusing on the cost of living emergency.
Thank you for that answer, Andrew. Truly covering a wide breadth again. There's definitely always a lot going on in public health, and that leads me well on to my next question. With so much involved in public health, sometimes it may be a bit overwhelming for people who are looking into getting involved in public health. To the young people watching today who want to gain some experience or find out more about public health, what's one small tip that you might give them if they're hearing you talk about this, how much public health is doing?
Yeah, I mean, that's one of the great things about public health, the breadth of it, but it's also the downfall in that sometimes it can be difficult to prioritize what we do to the most important thing. But I think if you're a young person, just pick an issue that you feel excited about and passionate about. It might be climate change, it might be global health, it might be the health of young people, it might be something around mental health. Just pick one thing that you feel passionate about and just do some exploring on the internet to find out a bit more about it. Consider, volunteering for a group within your own community that's perhaps doing some work on this. People are always looking for support and for help on these issues. So I would just that would be my top tip, just to find one thing. I think the other thing I just kind of mentioned, Yaz, is the importance of having a mentor. And certainly during my career, when I was at medical school, there was a professor of pediatrics who I kind of somehow latched onto, and he was very kind in just kind of advising me from time to time when I was kind of struggling a bit and needing to know what to do next. And when I was just kind of reflecting back once I was preparing for this talk, I was just thinking how I've benefited at different stages from different mentors, people that have kind of helped me and guided me along the way. So if you're a young person thinking about setting off on this journey, and if you can hook up with a local group and find somebody that's prepared to mentor you a bit or just kind of guide you on that journey, I think you'd find that really helpful too.
And from my own personal experiences, I can also attest to that. I've got my own mentors who've really helped me along this journey into public health and into my medical career. And usually those with the most experience really do want to teach. They want to pass on their experience to the next generation, because those are the people who are going to be leading the NHS, leading the country, leading the planet, really. So some truly inspiring words from yourself. I want to thank you so much, Andrew, for your time today. It's been truly inspiring to hear from you. And do you have any final words for us before we pass on to one of my colleagues, Raj? Oh, God.
So,
there you go.
Hi, Andrew. Nice to meet you. It's great to be here with Yaz, Andrew, and the amazing health and care community today. And I think we can all hear each other. You might be at the end of a school day. It's a Friday. Thanks to all the teachers that are hosting this live. In a classroom, on a phone, on an iPad, on a tablet. You might be in a GP surgery, and we're so thankful to those health and care professionals that have gone out of their way in the last few weeks to support this programme and to share it locally. And how great does Yaz look with this Instagram cutout? So this was from the first conference 5 years ago that was held in the birthplace of the NHS in Trafford. And it's a pity we can't pop one on Andrew, but Andrew is very active on Twitter. And please do share your thoughts and all your emojis. So whilst I'm here, I wanted to ask Andrew, Yaz, Lucy, who's filming at the back from the Virtual Studio Live team, a question. How are we going to take this momentum forward today? How are we going to continue these conversations? But more importantly, how are we going to take all the fountain of wisdoms, the great knowledge, the energy into our local communities? Andrew touched on some really salient points. This isn't just about human health. This is about health, well-being, One Health. And tomorrow we see the British veterinary community coming together. So the British Veterinary Ethnicity and Diversity Society have been supported by the BVA and the Royal College of Veterinary Sciences to support anyone to work in veterinary careers, whether that be in rural communities or as a STEM-based career, looking at vaccines and how we're supporting agriculture. And that's one of the things I wanted to touch on, really, because today has been about human health. It has been about clinical careers, the NHS. But how about well, do you know what? I'm getting bored of my own voice here. So one of the things I wanted to share was a big appreciation to Andrew for taking time out of his busy schedule to join us live. And Andrew, will you promise to join us in person in the future if we're able to? And also, it'd be great to see Andrew and his colleagues in the public health team share more about the work that's going on in the Northwest and in the country. Because it's only because of people like Yaz, Andrew, that we're able to take things forward. So thank you so much. I'm conscious I interrupted Yaz and Andrew, and we still have to hear Andrew's golden words of wisdom for all of us. Following that, we'll talk about the programme, what's coming on tomorrow, and a really interesting session on gender disparities in healthcare and STEM. That's following this amazing session. So over to Yaz and Andrew, and I'll be back in a few minutes. Whilst you're there, use the hashtag. The Reflections Diary is online. Please do fill it out, and we'll be able to support any references and any official certificates from this work experience online programme. So thank you so much again for sticking with us, and I'll be passing back to Yaz in the studio with Andrew.
Thank you so much for that. Truly fantastic. As Raj was mentioning, there's going to be some great work tomorrow that we're going to be doing, and many more great speakers coming from across the health care sphere. Sorry, Andrew, so I want to give you a chance to give any final words, and now you've got much more ammunition to work with for your final few words.
Thank you. And Raj is a tour de force and a force of nature there, and thank you, Yaz, for kind of hosting this session. I'd love to do it in person. Very happy to come back again at another occasion and develop these themes. In terms of Raj's challenge about how we keep this going, again, I would just encourage people to just think of one thing that you can be doing this weekend, perhaps for yourself, because health needs to start with yourself. You need to look after yourself and kind of practice what you preach in a way. So just think about one thing this weekend that you could be doing for yourself, and then think about extending that out to those that you love, and then think about extending that out to the community in which you live. It might be about looking after your own mental health, for example, and thinking about how you can look after and improve the mental health of those that you love and those who you live with. So that would be my top tip for this weekend.
Thank you so much, Andrew. Once again, it's been an absolute pleasure to have you, and we hope to see you next year and in many more years coming. And if not you, then other members of your team coming along, hopefully. So thank you so much once again.
Thank you.
There you are. So thanks so much, everyone, for tuning into that great session. Andrew's had some amazing points that he's been making throughout. He's been handed a billboard from the first billboard we made in 2019 for the Health Careers conference, and look how far we've come. We've done it in person, we've done it online, we're doing it hybrid. Who knows where we'll be next year? Maybe in your home city. That's the plan. Just to pass on from what Andrew just finished saying, those of you who are in the healthcare system and maybe a little bit further along, maybe you remember what it felt like to be in a position prior to yourself, and there is the next generation who want to learn and want to be part of this. It's evident by their attendance today. So whenever you do get matched up, whenever you do cross paths with that next generation, looking out for them and seeing that they were once in your shoes would be truly inspirational. And hopefully we can keep the momentum of Health Careers Live going for the future and to many years to come and continue growing our network. Thank you so much, everybody, and we'll be right back in a little while.
Sure, I'll pass you this.
And thanks so much for holding on. This has been a long day. We hope you're taking time out of this amazing experience to stretch your legs, hydrate, grab a nibble, and this off because it costs to produce, stuff that we're consuming, and we're currently living in an age where we have a shortage of resources. And it's only because of people like Yaz, like the National Health Careers Conference team today, that we're able to reuse knowledge. Does knowledge change? Is knowledge data and interpretation? These are just some things to think about. And on that reflections diary that you have in front of you, for reference, it has been shared on the platform. You can view it on the website. This is a General Medical Council accredited with the NHS England Reflections Diary. A reflection is a thought. It can be something that you feel when you're listening to Andrew, to Bowler, who introduced a conference this morning with Steve, both National Medical Directors of our National Health Service in England. But a reflection diary is your safe space. It's your place to share how you feel about health and care. Is this a career for you? Is this something that you've joined and you've learned, actually, I can be helpful? You might not need a career in the NHS. You don't need to become a doctor to help people. You don't need to be in the NHS to be someone that's supporting your local community. Each day you're supporting many people around you. This conference has only been made possible due to Health Education England, the National Health Service. The libraries across health and care are places of learning and reflection. Tomorrow we'll hear from Sue Lacey-Bryant, the Chief Knowledge Officer for the country. Sue has been a driving force behind ensuring that every health and care learner is able to support their learning and the learning of their peers. Shortly, we'll be tuning into a session led by the chief lead of ICGRX, which was the world's first Wikipedia-esque global grand round that took place in 2015 with the support of Jimmy Wales, the founder of Wikipedia. The session will be led by many esteemed speakers, including Dame Jane Dacre. Dame Professor Jane Dacre was the first female president of the Royal College of Physicians. It only took 495 years for there to be a female leader of one of the oldest royal colleges within medicine. These are issues we're grappling with today, and they still exist. So, without further ado, I'd like to signpost you to the website and the attendee pack. Please share your reflections. Do jot them down as you go along. And we'll see you again after this talk. The day will then come to a close for today. You'll have time to enjoy, and we'll start again tomorrow. All the best, and see you soon. Hashtag Health Careers Live.
Hello, everyone. Welcome to the audience, the panel members, and thank you for joining us for a discussion on the gender disparities in healthcare and STEM. We'd like to thank the Women in Medicine Summit for their collaboration. Please sign up for their conference happening October 9th and 10th this fall. I'm Isabel Hardy, a resident physician in the US, and I'll be moderating this panel, along with Zach West, a physician in Atlanta, Georgia. Now, while the American Medical Association reports that women in the US make up 36% of the physician workforce, which is up from 6% in 1950, this still does not reflect the demographics of our society. Additionally, there's an even more drastic disparity in the number of women in leadership roles. One of our speakers, Dr. Jennifer Downs, led an international study published in The Lancet analyzing gender disparities in global health leadership and how gender-specific challenges manifest in career advancement. Dr. Jane Dacre is leading the Gender Pay Gap in Medicine review in the UK, and in an interim report, said in an article with the UCL News that the gender pay gap is 17% based on total pay. Dr. Fernanda Staniszewski writes in Science that COVID-19 has put disproportionate burden on women in STEM and asks for policies and actions to mitigate the motherhood penalty. And Dr. Vineet Arora has worked with a group of physicians and the Women in Medicine Summit to publish a matrix on how to addend CVs in the COVID time. These issues and more will be discussed in today's conversation. Now, before we begin, I'd just like to briefly run through how the session will work. Questions on the topics have been prepared, and each question will be directed to one speaker to begin with. We encourage all speakers to join and provide their input. After the question has been discussed, we'll move forward with the next. We're very excited to see what today's discussion brings. So without further ado, we'd like to ask the speakers to introduce themselves, starting with Dr. Downs.
Hi, I'm delighted and honored to participate in this panel today. Thank you so much for inviting me. I'm an associate professor of medicine, microbiology, and immunology at Weill Cornell Medicine in New York City. And I conduct my research and teaching at the Weill Bugando School of Medicine in Mwanza, Tanzania. I received my MD from Weill Cornell and my PhD in parasitology from Leiden University in the Netherlands. And I'm board certified in internal medicine and infectious diseases. I've been working in Tanzania since 2007, and I teach Tanzanian medical students and American medical students and conduct research on parasitic worm infection, schistosomiasis, which is extremely widespread in Tanzania. I'm specifically studying the relationship between schistosome infections and susceptibility to viral infections, including HIV in girls and women. I also focus on improving girls and women's access to reproductive health care in rural Tanzania. And another major focus of my career has been training and mentoring students interested in global health careers, particularly women, from both the US and from Tanzania. I'm particularly interested in interventions to foster the careers of women scientists in global health. And for the past 6 years, have led an initiative that seeks to understand barriers faced by women internationally that lead to their attrition from global health research and leadership, and to address those barriers so that we can retain and promote women to leadership globally. Thanks.
Thank you, Dr. Downs. Dr. Dacre, would you like to introduce yourself?
Hi, my name is Jane Dacre. I'm Professor of Medical Education at UCL Medical School in London. I'm a general physician and rheumatologist. I'm the immediate past president of the Royal College of Physicians of London, which is the oldest medical Royal College in England. It was 500 years old in 2018. I first got interested in women in medicine 10 years ago when I led a report called Women in Medicine, the Future, and my interest has been increased recently because of looking at the gender pay gap in medicine in England. And I was commissioned by the then Secretary of State to lead a project looking at the gender pay gap in England. And I can tell you, it is a substantial gap and we need to do something about it. Sadly, the gap report has not been published because it was due to be published in the week of lockdown. So I hope everybody's waiting with bated breath, but I'll give you some edited highlights during the course of the next hour. So thank you very much for inviting me. I'm really looking forward to the conversation.
Thank you so much, Dr. Dacre. Dr. Staniszkowski, do you want to tell us about yourself?
Hi, everyone. Thank you so much for the invitation. It's a pleasure to be here to talk about it. I'm a molecular biologist from Brazil. I'm not a physician. And I'm a founder of the movement we called here Parenting Science. We were created in 2017 to discuss how motherhood impacted the career of women in STEM. So we've been bringing data to foster the creation of public policies to support women in STEM and to guarantee that we can try at least to decrease the motherhood penalty we see in science in general. So we are now working on how the COVID pandemic is impacting women in science, and we'll be talking about that today, I guess. So thank you.
Thank you, Dr. Staniszkowski. Dr. Aurora, would you like to introduce yourself?
Yes, thank you for having me and greetings. My name is Vineet Arora, and I am a physician and a hospitalist here at the University of Chicago, where I'm a professor of medicine, and I serve as the Associate Chief Medical Officer for the Clinical Learning Environment, as well as an Assistant Dean at the Pritzker School of Medicine. My work in women in medicine, and particularly in gender equity, spans from examining and improving gender disparities for medical trainees at the evaluation level, all the way to the leadership level, where I have participated in several studies looking at pay gap as well. My personal interest in this topic stems from the fact that I am also a mother and have a 12-week-old at home, and I already have tenure. And so I start thinking about how is it that women face and go up this path when they are in their reproductive childbearing years. At the same time, they need to make it in academic health professions. And so I've been on maternity leave during the, a portion of the pandemic, and I've had time to think about that. And so I look forward to sharing my thoughts, as well as I'm pleased to be sponsored by the Women in Medicine Summit, and I'm also a founding member of Time's Up Healthcare. Thank you.
Thank you, Dr. Aurora. Briefly, Zach and I will just introduce ourselves. I'm a pediatric resident on the global health track at University of Colorado. I got my medical degree from Emory in Atlanta, Georgia. I was actually my school's chapter president of the American Medical Women's Association. And prior to that, I worked at the NIH. I studied at William and Mary in Virginia, and I'm looking forward to a career in academic medicine. Zach, would you like to introduce yourself?
Yes, yeah. I'm Zach West. I just graduated from Emory University School of Medicine with Isabel, and now I am a resident at Emory University as well. I'm excited to get more involved in advocacy for my patients as I'm working in the pediatric population. So I recognize that the changes that we make today will affect their lives for the rest of their lives. And so I want to do what I can and learn what I can to improve the culture in medicine, so that I would be happy to send my daughter and make it easier for her in the future to join the field and go into a position of leadership.
Thank you, Zach. So getting started with our discussion. As I mentioned, the number of women in science and in healthcare has risen globally over the past 70 or so years. However, this rise does not correlate to our respective nations' demographics. This question is for Dr. Staniszewski to start. What can be done to meaningfully support women interested in science and medicine and to increase the number of women in these fields?
Okay, so one thing we need to do is to show role models. We were talking early this week on another seminar I was participating that several women were reporting that they feel they have to choose between their private life and the professional life. So we need to show that we can have both, because we can. So that way we can make women more willing to pursue a career in science, because that we still have a model that the scientist is a male, a white male. So we need to change that. So showing that we have a lot of very capable, very inspiring women in science is very important. When we are talking about career progression, we have a lot of things to discuss. We need to talk about the motherhood penalty. That's really important, and that's what we are doing here from Brazil. And we are starting a collaboration internationally to discuss this matter globally, because it's not an issue just here in Brazil, it's an issue everywhere. So we need to support women to return after they leave for maternity leave. So it's really important to bring data to this discussion. So here in Brazil, we showed that after the women have their child, they will decrease their productivity in considering publications, for instance. So we need to support their return to science so they can be able to sustain their career. Because at least here in Brazil, we didn't have anything related to motherhood when we were discussing grantings and fellowships. So because of our movement, we were able to create some rules in our funded agencies that will take into account the period that women are leaving for childcare and all that stuff. So I think that's really important. We need to discuss this openly. One other issue that we have that is really important is harassment. We need to talk about it, because that is one of the main reasons women are leaving academia and science and in all the fields. So we need to start to discussing things openly, and that's the only thing I think can help in all this fight we have on women pursuing a career in science and staying in science throughout their career.
Thank you, Dr. Staniszewski. Would anyone else like to weigh in on this question?
Can I just add that a lot has been talked about recently about structural racism, but I think there's a broader term, which is structural inequality. And I think one of the things that holds women back, and our pay gap report has shown, is structural inequality. There are more career barriers put up in front of women than there are men. And where the motherhood penalty comes in, that makes it worse. But you're also less likely to be promoted to the most senior positions in health systems, or indeed in scientific systems if you're female. And that is due to hidden structural inequalities. And these are made up by years and years and years of working in a male-dominated set of professions. And so we need a root and branch review to make sure that women are not discriminated against in that way. And the way to do that is to collect data. So if you have data that show the inequalities, then you're in a good position to try and reduce them.
I wanted to pick up on that point and highlight that one of the issues around, even in the US, where we have 50-50 split between women and men entering medical schools, for example, but we at the professor level, only 1 in 4 currently, based on the recent reports, will make it to professor. It's really not just about numbers, it's about inclusiveness at every level and mentoring and addressing implicit and explicit bias that my co-panelists have really mentioned. And so I am all about data. I like to collect data as well, but I also want to highlight the immediacy and need of solutions. We see this in the United States, especially around issues of diversifying our pipeline. We have been trying to diversify our pipeline with more minorities in medicine for years.
We've done in the poor countries where we work, where there isn't a lot of money to support some of these other interventions, is we've really learned the power of peer mentorship. We were conducting focus groups for our study, and just from the single focus group, at the end of our session, had embracing numbers and saying, I never realized women were facing these big, it's immediate. Providing women to support, and when you lack senior role models, there's a lot of collective wisdom from your peers. So that's something also we've been starting to roll out. And there's data to support that in engineering. When peer mentorship groups were established and when they were all female, the women that were in those peer mentorship groups 2 years later went on to, were more likely to be optimistic about remaining in the field. They were more highly motivated compared to when they were mixed gender. So I think that those peer female mentorship groups also are free and can really make a difference.
Thank you. Zach, would you like to present the next question?
Yeah, so actually jumping off of that, I'm gonna jump around a little bit on our question list because this plays in so well with what you were just talking about, Dr. Downs. So stemming off what you were mentioning about women as role models and coaches, this can play such a big role in elevating those that they work with. So what are your experiences with your own mentors, and how did you identify who would be a good mentor? And perhaps if we have time to get into it, what have you learned about being a good mentor to other women in medicine and science in general?
Is that to me?
Yes, Dr. Downs.
Sure. Okay. My 2 primary scientific mentors are both men. They're senior leaders in global health, and they've been tremendous mentors, actually. They are family oriented, and I have 3 children, highly supportive, and they've been incredible. I think I've also learned along the way this concept of creating a web of mentors and how valuable that can be, because no single person is able to give you all the mentorship and have the expertise that you need. So at various times in my own career, I've cultivated and pulled from the expertise of a web of mentors, and for all different things. So for the Women in Global Health Research Initiative that we lead, we've drawn from a senior female leader who leads our graduate medical education program at Cornell, and used her expertise to teach us how we can train women and how we can train women to be mentors and leaders. At other times, I've been stymied by my research findings, and I've reached out to a senior immunologist, internationally known. And other times, I've reached out to my own female peers, somebody else struggling to raise 3 kids and do global health research. And so I think there's so much value in reaching broadly and not just saying like, this is my one scientific mentor, but reaching out to other people.
Can I just add to the concept of mentorship? Because mentorship is great and really, really supportive for the people who are being mentored, but I think we need to do more. So I'm at the other end of my career and I mentor a lot of people, but I now realize that I should be doing more. And what I should be doing is coaching them, in supporting them and telling them how to do things sometimes, rather than just being that reflective mentor. And then the other is engaging in sponsorship. So where I have the opportunity to put a woman's name forward to be considered for a position, I will now very specifically do it. So I will say to somebody that you need to go for this job, And when someone asks me who might be a good person to go for a particular job, I will nominate women specifically. So not only mentoring, but coaching and sponsoring. So be strong about it.
I do want to share an interesting story that just happened to me yesterday, when I actually was following exactly that advice and also see myself more as a sponsor. I also mentor a lot of women, but also coach and sponsor. There was an amazing opportunity at the National Academy of Medicine, and I get to be a nominator, and I have a woman who I was thinking about for nominating, and she is a woman of color. And I reached out to her and said, I'd like to nominate you. Can I get your CV? And she said, well, I don't know if I can do it. Is it right for me? You know, and I realized that, you know, this is a two-way street, which is that, you know, even when the gate comes for the sponsorship opportunity or the mentorship opportunity, it behooves us. And I talked to her by phone and I said, you know, I want you to think like a man, and, you know, remember, you may not get this opportunity, but just by going up for it, even if it's a reach, you'll have your CV evaluated by the people in your field that hold the gates to future opportunities. And so I do want to say, for any young people out there, a lot of women suffer imposter syndrome all across the pipeline, all the way to leadership levels, but especially at the most junior stages in your career or at career transitions. Don't be afraid to go through the gate. Don't be afraid to ask for sponsorship. Don't be afraid to ask for coaching. You're not going to be able to do it by yourself. And so one of the key things to remember is that, you know, we don't have enough women sponsors, so we're going to have to seek out men to sponsor us. And sometimes that's important. And if you're afraid to do that, that's going to be actually an important part of you getting coached to actually overcome that fear and actually make the request.
Excellent points from everyone. Sort of jumping off of that point, as we already heard, there's been a flux in the demographics of medical school classes, such that in many places, women even make up the majority of students. Despite the increasing number of women earning their medical degrees, the percent of women in hospital leadership specifically remains in the single digits. So this question to Dr. Arora, why do you think the leadership gap exists, and what's holding women back from leadership?
This is an important question. I think, you know, this really gets at the heart of some of the issues around implicit and explicit bias. And so one possibility that I often hear, which is a myth, is that women don't want leadership positions. And that's actually, studies have shown that that's not true. And so women do aspire to leadership positions at the same rates that men do. What often happens is that the path of trajectory of early career launch points in your career that will take you to the next step or take you to the next plateau happen to coincide with when women are often building families. And so, so you see, as my colleague has pointed out, the mommy tax at play, the mommy penalty. And so there's definitely a motherhood penalty. And so women are held back. And so you're going to see men make the jump to leadership earlier than women, as long as we still have that in place. The second is that there is also a really important bias around women leaders. And so the role of leader is, when you think about leader, what comes into your mind? You know, probably not a woman. It's probably a decisive male-dominated figure that is very confident and is able to have what we call these agentic traits. When those traits are actually in direct opposition to what people think of as innately female or innately feminine.
So Dr. Dacre summarized that basically that a lot of the education and our systems have been structured around the white male. And so we have to start addressing that and creating action to actually integrate or create solutions. Isabel, do you have anything to add from that?
I think these were all great points, and I totally agree that our medical system is sort of a round peg in a square hole, in that women are asked to conform to the standards of men despite different roles at home, different expectations from society.
Okay, and then I'll go on to the question to Dr. Stanisławski. So throughout the COVID-19 pandemic, even people in science and STEM have found themselves furloughed or laid off. Others have had growing responsibilities outside of the workplace. How has COVID-19 affected the professional development of women who occupy roles in science and medicine?
So we have conducted a study here in Brazil, asking about, we interviewed close to 15,000 scientists from Brazil. And we show that women, especially women with children, they are not able to work remotely. That's what is happening now. So during this period where schools, daycares are closed, women are the ones that are taking the biggest hit on their careers because they are taking care of children and all the house chores and everything. So we showed with this survey that only less than 10% of our grad students, there are females that have children. They are able to keep on working on their thesis or dissertations during this period of the social isolation or quarantine. For researchers, we showed that women with children only around something 20% or so are able to submit papers during this period. And when we looked at men, this goes up to 70% of men reported that they are able to submit papers during this period of the social isolation. So there is a gender effect on how the pandemic is affecting how we are working at this period. Here in Brazil, one main thing we need to discuss is race. So we also showed with this survey that women of color, they are suffering way more than white women. So we need to discuss this in order to try at least to minimize all these effects we are seeing, because otherwise there will be a huge increase on the diversity gap we have in science, not only women, but also people of color. So even though our study was conducted only with Brazilian scientists, we have almost 15 scientists that were interviewed. So we believe that is a pretty good number to show that there is a gendered and there is a racial impact of the COVID-19 pandemic in the career of scientists, not only for females, but also for males, so people of color. So we believe we can at least have some rules in our funding agencies. For instance, we showed that almost 40% of the women that did not miss a deadline regarding grantings or fellowships, they did so because the agencies extended the period for the application. So we are right now writing to our funding agencies here in Brazil requesting that as long as possible, all the deadlines be extended during this period, or otherwise there will be a difference of how women and men are able to compete for grants and fellowships. So this is the main thing we are seeing right now. And this is reflecting what scientific editors from several journals were reporting in April and May, that the number of submissions by females were decreasing. So we were able to show that both race and parenthood are impacting, and they are the main cause of this difference we are seeing on gender about submissions during this period.
Great, thank you. That's a great insight. Dr. Aurora, you and Dr. Shapiro, along with Dr. Ray, and I think Dr. Glasser, put together this amazing matrix to help adjust for COVID time that is published on the Women in Medicine website. Would you mind taking a minute to talk about that? And yeah.
So actually, I want to pick up on the point about it's not just Brazil with race. For those of us in the United States, and especially me on the south side of Chicago, Minneapolis, Atlanta, all of our major cities, everywhere, we are struggling with two pandemics, not just the issue of COVID-19, but also the issue of structural racism and police brutality against Black men and women in our country. And this actually is coupled together, and for our Black men and women in medicine in particular, especially for the women now that are at home or dealing with their children, they're suffering a mommy tax and a minority tax. And so in the midst of this, they're being asked, and not only that, disproportionate share of COVID-19 in our country does fall victim in the Black and Brown communities. And so this is an incredibly stressful time for our Black colleagues in medicine, particularly for the women. And so I've been thinking about this a lot, and I sit on our promotions committee, and with a group that you've described, Dr. Shapiro from Explore the Space, Dr. Glasser, Dr. Ray, as well as Dr. Jane from Women in Medicine Summit, we have thought a lot about the curriculum vitae, the CV, as sort of the currency of promotion, if you will. And so if that's the case, and when I sit on our promotions committee, I'm evaluating CVs, I write promotion letters, I'm evaluating CVs. How am I going to evaluate a CV unless I know exactly what, how to document the impact of somebody's COVID time has been really accounted for? Otherwise, if I just look at this, I'm looking at this deficit model where I'll see all these papers for a woman and then it fell off and I'm not sure why. And usually when that happens in promotions committees, somebody might volunteer like, oh, so-and-so had a baby. And it's sort of like they're like, oh, okay, we'll let that pass. But that's not exactly the correct model if you think about from a structural issue, how should we be thinking about equity? And so I thought, well, what if we were to amend the CV, similar to a table that gets put forth with promotions committees about what people do and account for their time? So what if we were to amend the CV with a matrix that actually allowed people to not only account for their disruptions, research that's been halted or, classes that have been converted to virtual? That took a lot of preparation and hours. That should be accounted for. Moving your practice to telehealth, as well as your novel contributions. We have seen particularly health professionals doing amazing jobs, volunteering, redeployed, doing maker communities for PPE. And as I know, our medical students here on this panel have been doing a lot of work as well in that area. And so how do we account for those contributions better, as well as caregiving? So perhaps you were at home and you had, you had a spouse or a partner who was deployed and was worried about COVID and they weren't even with you. And so you were doing solo parenting and dealing with, the virtual schooling and dealing with telehealth. So how do you better account for that time so that people have a more holistic picture of what you were doing during the COVID time? And so it might be that you were doing 6 weeks in the COVID ICU. That's enough. And so if you don't have any contributions in any other bucket, fine. It might have been that you got sick or you were taking care of other people that got sick. So these are important discussions to have out in the open, I would argue, to really promote equity, as opposed to having it just be volunteered on the side or, and really just, the matrix is a way to organize your contributions, efforts, as well as your disruptions to get credit for it, if you will. And so it's available on the Women in Medicine Summit website, and Explore the Space has a podcast out about it. So if anyone wants to learn more, there's plenty of resources.
Thank you, Dr. Aurora. I want to capitalize on a point you made about women putting in more work outside of the workplace, especially during this time, and actually pull on Dr. Dacre's expertise. So Dr. Dacre, you've done a lot of work with the gender pay gap. I was listening to a discussion recently, and it was by Dr. Jim Dale, who many people know as the white coat investor. And he contended that the gap is at least mitigated by women's respective interest in pursuing other facets of their life. So for instance, home life. And that may mean taking a lower paying job at the expense of, say, flexibility. So Dr. Dacre, what does your research tell us about this pay gap and how women can confront unequal compensation to their male counterparts?
So I think firstly, it's important to recognize what a pay gap is, because a lot of people get confused about the difference between equal pay and a pay gap. So equal pay is a legal concept in the UK and has been for 50 years, and that's equal pay for equal work. But what a pay gap is is the definition is that it's the average difference in pay per hour for women as a percentage of men's pay. And what that means is that as women go through their careers, because they do other things, because they have children, they accrue a pay deficit, which is actually very significant and impacts on them. And this is actually, in my view, a surrogate measure of inequality for women in medicine. And in the work that we've done, we've shown that it's really very substantial for a single profession, being 18.9% for hospital specialists, 15.3% for GPs, and 11.9% for clinical academics. Now, that clinical academic number is probably an underestimate. We've also looked at how do we get over that? How do we reduce that gap? Now, the concept that you were talking about to me is unequal and unfair in a society where we have now in the NHS in England 70% of women working. And if you continue to accept that women's career trajectories and pay trajectories are slower, you'll get women leaving the workforce, and we don't have enough workforce of men and women already. So the things to do is, number one is promote more women. And I was really interested to hear Dr. Aurora's view about how you might want to promote more women and how you need to put in place mitigations to be able to promote more women. The second is the issue of structural inequality. We need to stop designing workforces that promote the white male above other people. We've just got to have zero tolerance to that. We've got to look at that right back to root and branch. The next thing is that we need to have transparency in reward and pay. So if we're paying men more for a job that they're doing, or if they're able to earn more over their careers than a woman, for example, a cardiothoracic surgeon compared to somebody in palliative medicine, then we need to make that clear so that people who don't like those discrepancies can choose which career pathway they follow based on data. Another is that the laws around this tend to be nudge laws. They're not real mandatory changes. So we need to have much stricter rules about how many men and women there are within particular specialties, for example, not just say, oh, there aren't enough women in surgery, let's think about how we might get some more. Another thing is the culture. Why would a woman stay in a workplace if she's constantly bullying, harassed, undermined, and being subjected to microaggressions? She won't. So if you want equality in the workplace, you've got to address these things. Another one is bonuses. Why should men get more bonuses than women? And they do. So we need research into all of these things to try and monitor their effects and to try and implement things that will minimize them and then see whether they're working.
Hopefully other men as well have learned what they can do on a personal, individual and institutional level to promote women, because honestly, it's time to do it. And I hope that we can come together and promote women as best as we can. So thank you so much for all being part of this panel. We really appreciate your insights and expertise. And we hope you have a nice day.
Thank you very much. It's great to be here in Altrincham, where the National Health Careers Conference first started 5 years ago. And since then, it's been doing a fantastic job communicating to many thousands of young people the great spectrum of different opportunities there are in the National Health Service and in the wider health sector, giving those young people the wonderful opportunity of fulfilling careers, serving the community, and helping to make our country and the world a better place.
Here we are live at the NHS Parliamentary Awards, and it's so great to be here with Professor Stephen Parris.
Hello, my name is Stephen Parris and I'm the National Medical Director of the NHS in England. Now, believe it or not, it's probably nearly 45 years since I started working in healthcare as a medical student, but actually I did a few summer jobs packing cotton wool balls, 5 cotton wool balls into a sterile packet for use in operating theatres as a summer job. And I've worked in all sorts of jobs ever since, obviously mostly as a doctor in lots of different hospitals. And I finally got to become National Medical Director, which is a real honour and a privilege. But if you wind back 45, 50 years, I would never have imagined that I could have had such a wonderful career in healthcare. It really is the best thing that you could do, because fundamentally we are here, I am here to help others, to help fellow citizens and people at their most needy time when they are ill, and also ensuring, of course, that they keep well. And of course, you don't need to be a doctor. There are literally hundreds of jobs in healthcare. Of course, there's nurses, paramedics, but there's also porters and cleaners and informatics experts who make sure that all the IT is working and that we're looking to the future of artificial intelligence and all those things you read about. So whatever your background, whatever your interests, there is a career for you in health. And I would really encourage you, because it is the most wonderful career to have and the best possible place to work.
It's been a brilliant day bringing together so many different organisations, healthcare professionals, students from across the UK and beyond.
It's an amazing opportunity to learn about such a huge range of health careers. We hear a lot about like medicine and dentistry, but we don't often hear as much about the 350 roles within the NHS, and that's something that as a conference we hope to try and challenge, to get people to think beyond the courses that everyone knows about.
There's something for everyone, and it's from like undergraduates for students, all the way up until people who are graduated and are working.
We've got AHPs, we've got aspiring medical students, dental students, nursing students, so everyone's represented here.
It is designed to have something for literally anyone. No matter what you're interested in, we will have a talk that covers it.
This is a brilliant programme that brings together so many different professions within the healthcare community, and it's one that should definitely be on everyone's calendar.
My name is Mark Radford. I'm the Chief Nursing Officer for Health Education England.
I'm Sarah. I'm a neurosurgery trainee currently working in Cambridge.
I'm Adrian James. I'm the President of the Royal College and I'm really delighted to be here.
My name's Abby and I'm the Careers Information and Quality Lead for the NHS Health Careers team. I hope to be able to get across to you some of the amazing opportunities within the NHS.
We have got podiatrists, occupational therapists, speech and language therapists.
So we're going to talk about good medical practice, we're going to talk about protecting patient safety.
Because of the restrictions, because of remote working, because of the lack of face-to-face contact, because we've had to manage patients a different way, we've had to think differently about how we manage this work and how we use technology.
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi Ian.
Hey guys.
We are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future.
It's been really interesting hearing all your top tips. I've got my list now. I can pack my bags. I'm going to wear my seatbelt for safety, but I am going to look out the window ahead of me and enjoy the trip.
It's just about us finding the greatness within us and bringing it out and being our best self.
Welcome to Health Careers Live.
Thank you very much. It's great to be here in Altrincham, where the National Health Careers Conference first started 5 years ago. And since then, it's been doing a fantastic job communicating to many thousands of young people the great spectrum of different opportunities there are in the National Health Service and in the wider health sector, giving those young people the wonderful opportunity of fulfilling careers, serving the community and helping to make our country and the world a better place.
Here we are live at the NHS Parliamentary Awards, and it's so great to be here.
It's been a brilliant day bringing together so many different organisations, healthcare professionals, students from across the UK and beyond.
It's an amazing opportunity to learn about such a huge range of health careers. We hear a lot about like medicine and dentistry, but we don't often hear as much about the 350 roles within the NHS, and that's something that as a conference we hope to try and challenge, to get people to think beyond the courses that everyone knows about.
There's something for everyone, and it's from like undergraduates for students, all the way up until people who are graduating and are working.
We've got AHPs, we've got aspiring medical students, dental students, nursing students. So everyone's represented here.
Is designed to have something for literally anyone. No matter what you're interested in, we will have a talk that covers it.
This is a brilliant programme that brings together so many different professions within the healthcare community, and it's one that should definitely be on everyone's calendar.
My name is Mark Radford. I'm the Chief Nursing Officer for Health Education England.
I'm Sarah. I'm a neurosurgery trainee currently working in Cambridge.
I'm Adrian James. I'm the President of the Royal College, and I'm really delighted to be here.
My name's Abby, and I'm the Careers, Information and Quality Lead for the NHS Health Careers team. I hope to be able to get across to you some of the amazing opportunities within the NHS.
We have got podiatrists, occupational therapists, speech and language therapists.
So we're going to talk about good medical practice, we're going to talk about protecting patient safety.
Because of the restrictions, because of remote working, because of the lack of face-to-face contact, because we have to manage patients a different way, we've had to think differently about how we manage this work and how we use technology.
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi, Ian.
Hey guys. We are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future.
It's been really interesting hearing all your top tips. I've got my list now. I can pack my bags. I'm going to wear my seatbelt for safety, but I am going to look out the window ahead of me and enjoy the trip.
It's just about us finding the greatness within us and bringing it out and being our best self.
Welcome to Health Careers Live.
Thank you very much. It's great to be here in Altrincham, where the National Health Careers Conference first started 5 years ago, and since then it's been doing a fantastic job communicating to many thousands of young people the great spectrum of different opportunities there are in the National Health Service and in the wider health sector, giving those young people the wonderful opportunity of fulfilling careers, serving the community and helping to make our country and the world a better place.
Here we are live at the NHS Parliamentary Awards, and it's so great to be here with Professor Stephen Parris.
Hello, my name is Stephen Parris and I'm the National Medical Director of the NHS in England. Now, believe it or not, it's probably nearly 45 years since I started working in healthcare as a medical student, but actually I did a few summer jobs packing cotton wool balls, 5 cotton wool balls into a sterile packet for use in operating theatres as a summer job. And I've worked in all sorts of jobs ever since, obviously mostly as a doctor in lots of different hospitals. And I finally got to become National Medical Director, which is a real honour and a privilege. But if you wind back 45, 50 years, I would never have imagined that I could have had such a wonderful career in healthcare. It really is the best thing that you could do, because fundamentally we are here I am here to help others, to help fellow citizens and people at their most needy time when they are ill, and also ensuring, of course, that they keep well. And of course, you don't need to be a doctor. There are literally hundreds of jobs in healthcare. Of course, there's nurses, paramedics, but there's also porters and cleaners and informatics experts who make sure that all the IT is working and that we're looking to the future of artificial intelligence and all those things you read about. So whatever your background, whatever your interests, there is a career for you in health, and I would really encourage you, because it is the most wonderful career to have and the best possible place to work.
Each of our 14 allied health professions are unique by role and diverse in skills. So given your chosen profession and you are training to be a diagnostic radiographer, if radiography was a cocktail, what would you suggest are the key ingredients that need to be mixed together based on skills, interests, strengths, that would produce the best top-class diagnostic radiographer?
So back to BMJ best practice, essentially it's a knowledge resource that answers clinical questions, but it doesn't just give any answer. It focuses relentlessly on what is important to our users. And what's important to our users is speed. They want answers quickly, within seconds. They want practical, actionable information for use at the point of care that can deliver clinical quality improvement. They want to be assured that the content that they have is continually updated and evidence-based, and they want to be able to access it on a mobile, on an app, online and offline. More about that in a second.
Whatever stage of life you're at and whatever your academic level, there will be a route in for you. And that's a really important message, because I think sometimes people think, well, I haven't got a degree, or I'm not going to be able to get a degree, I won't be able to join the NHS. That's just not true. Whatever stage of life you're at and whatever your academic level, there will be a route in for you. And that's a really important message, because I think sometimes people think, well, I haven't got a degree, or I'm not going to be able to get a degree, I won't be able to join the NHS. That's just not true.
For me, I think the whole issue is that when we think about how do we make the best clinical decision, there are three elements there. So one is about patients, their ideas, beliefs, and concerns and expectations. Clearly, we all want to follow evidence-based practice, but the third element is that individual clinical expertise. And I think that individual ourselves is often the forgotten bit. I think we forget the need to look after ourselves. We forget the need to empower ourselves and to feel empowered so that we can actually help our patients and use our expertise to help our patients.
Everybody always asks, well, why do I have to take BMAT? You know, why are you making me sort of do this? You've got my A-levels, you've got my application and so on. So for many medical schools, they actually have applications from a wide range of people who have all sorts of different qualifications. You know, even if we're looking at UK students, some of them will be from Scotland, they'll have Highers, be from England, Wales, but also from other countries as well, and different sorts of qualifications. So the BMAT actually gives them one piece of information which is common to all of their applicants.
One of the things that is happening, and this is particularly important to say at this Health Careers Live, is that what medical schools are being increasingly expected to do is make sure that they're getting the right representation of society from their medical applicants. And that's quite a challenge. I don't want to go into detail, but what I'm saying is that we're trying to make it more equitable in terms of applications and who gets in terms of a cross-section of our society.
It's been a brilliant day bringing together so many different organisations, healthcare professionals, students from across the UK and beyond.
It's an amazing opportunity to learn about such a huge range of health careers. We hear a lot about like medicine and dentistry, but we don't often hear as much about the 350 roles within the NHS, and that's something that as a conference we hope to try and challenge, to get people to think beyond the courses that everyone knows about.
There's something for everyone, and it's from like undergraduates for students, all the way up until people who are graduating and are working.
We've got AHPs, we've got aspiring medical students, dental students, nursing students. So everyone's represented here.
Is designed to have something for literally anyone. No matter what you're interested in, we will have a talk that covers it.
This is a brilliant programme that brings together so many different professions within the healthcare community, and it's one that should definitely be on everyone's calendar.
My name is Mark Radford. I'm the Chief Nursing Officer for Health Education England.
I'm Sarah. I'm a neurosurgery trainee currently working in Cambridge.
I'm Adrian James. I'm the President of the Royal College, and I'm really delighted to be here.
My name's Abby, and I'm the Careers Information and Quality Lead for the NHS Health Careers team. I hope to be able to get across to you some of the amazing opportunities within the NHS.
We have got podiatrists, occupational therapists, speech and language therapists.
So we're going to talk about good medical practice, we're going to talk about protecting patient safety.
Because of the restrictions, because of remote working, because of the lack of face-to-face contact, because we have to manage patients a different way, we've had to think differently about how we manage this work and how we use technology.
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi, Ian.
Hey guys. We are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future.
It's been really interesting hearing all your top tips. I've got my list now. I can pack my bags. I'm going to wear my seatbelt for safety, but I am going to look out the window ahead of me and enjoy the trip.
It's just about us finding the greatness within us and bringing it out and being our best self.
Welcome to Health Careers Live.
Thank you very much. It's great to be here in Altrincham, where the National Health Careers Conference first started 5 years ago. And since then, it's been doing a fantastic job communicating to many thousands of young people the great spectrum of different opportunities there are in the National Health Service and in the wider health sector, giving those young people the wonderful opportunity of fulfilling careers, serving the community, and helping to make our country and the world a better place.
Here we are live at the NHS Parliamentary Awards, and it's so great to be here with Professor Stephen Parris.
Hello, my name is Stephen Parris and I'm the National Medical Director of the NHS in England. Now, believe it or not, it's probably nearly 45 years since I started working in healthcare as a medical student, but actually I did a few summer jobs packing cotton wool balls, 5 cotton wool balls into a sterile packet for use in operating theatres as a summer job. And I've worked in all sorts of jobs ever since, obviously mostly as a doctor in lots of different hospitals. And I finally got to become National Medical Director, which is a real honour and a privilege. But if you wind back 45, 50 years, I would never have imagined that I could have had such a wonderful career in healthcare. It really is the best thing that you could do, because fundamentally we are here, I am here to help others, to help fellow citizens and people at their most needy time when they are ill, and also ensuring, of course, that they keep well. And of course, you don't need to be a doctor. There are literally hundreds of jobs in healthcare. Of course, there's nurses, paramedics, but there's also porters and cleaners and informatics experts who make sure that all the IT is working and that we're looking to the future of artificial intelligence and all those things you read about. So whatever your background, whatever your interests, there is a career for you in health. And I would really encourage you, because it is the most wonderful career to have and the best possible place to work.
Each of our 14 allied health professions are unique by role,
and diverse in skills. So given your chosen profession and you are training to be a diagnostic radiographer, if radiography was a cocktail, what would you suggest are the key ingredients that need to be mixed together based on skills, interests, strengths that would produce the best top-class diagnostic radiographer?
So back to BMJ best practice, essentially it's a knowledge resource that answers clinical questions, but it doesn't just give any answer. It focuses relentlessly on what is important to our users. And what's important to our users is speed. They want answers quickly, within seconds. They want practical, actionable information for use at the point of care that can deliver clinical quality improvement. They want to be assured that the content that they have is continually updated and evidence-based, and they want to be able to access it on a mobile, on an app, online and offline. More about that in a second.
Whatever stage of life you're at and whatever your academic level, there will be a route in for you. And that's a really important message, because I think sometimes people think, well, I haven't got a degree, or I'm not going to be able to get a degree, I won't be able to join the NHS. That's just not true.
For me, I think the whole issue is that when we think about how do we make the best clinical decision, there are three elements there. So one is about patients, their ideas, beliefs, and concerns and expectations. Clearly, we all want to follow evidence-based practice. But the third element is that individual clinical expertise. And I think that individual ourselves is often the forgotten bit. I think we forget the need to look after ourselves. We forget the need to empower ourselves and to feel empowered so that we can actually help our patients and use our expertise to help our patients.
Everybody always asks, well, why do I have to take BMAT? You know, why are you making me sort of do this? You've got my A levels, you've got my application and so on. So for many medical schools, they actually have applications from a wide range of people who have all sorts of different qualifications. You know, even if we're looking at UK students, some of them will be from Scotland, they'll have hires, be from England, Wales, but also from other countries as well, and different sorts of qualifications. So the BMAT actually gives them one piece of information which is common to all of their applicants.
One of the things that is happening, and this is particularly important to say at this Health Careers Live, is that what medical schools are being increasingly expected to do is make sure that they're getting the right representation of society from their medical applicants. And that's quite a challenge. I don't want to go into detail, but what I'm saying is that we're trying to make it more equitable in terms of applications and who gets in terms of a cross-section of our society.
It's been a brilliant day bringing together so many different organisations, healthcare professionals, students from across the UK and beyond.
It's an amazing opportunity to learn about such a huge range of health careers. We hear a lot about like medicine and dentistry, but we don't often hear as much about the 350 roles within the NHS, and that's something that as a conference we hope to try and challenge, to get people to think beyond the courses that everyone knows about.
There's something for everyone, and it's from like undergraduates for students, all the way up until people who are graduating and are working.
We've got AHPs, we've got aspiring medical students, dental students, nursing students. So everyone's represented here.
It is designed to have something for literally anyone. No matter what you're interested in, we will have a talk that covers it.
This is a brilliant programme that brings together so many different professions within the healthcare community, and it's one that should definitely be on everyone's calendar.
My name is Mark Radford. I'm the Chief Nursing Officer for Health Education England.
I'm Sarah. I'm a neurosurgery trainee and currently working in Cambridge.
I'm Adrian James. I'm the President of the Royal College and I'm really delighted to be here.
My name's Abby and I'm the Careers Information and Quality Lead for the NHS Health Careers team. I hope to be able to get across to you some of the amazing opportunities within the NHS.
We have got podiatrists, occupational therapists, speech and language therapists.
So we're going to talk about good medical practice, we're going to talk about protecting patient safety.
Because of the restrictions, because of remote working, because of the lack of face-to-face contact, because we have to manage patients a different way, we've had to think differently about how we manage this work and how we use technology.
I'm in London, so good to see you. I think we've got Ian here as well, haven't we? Hi Ian.
Hey guys. We are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future.
It's been really interesting hearing all your top tips. I've got my list now. I can pack my bags. I'm going to wear my seatbelt for safety, but I am going to look out the window ahead of me and enjoy the trip.
It's just about us finding the greatness within us and bringing it out and being our best self.
Welcome to Health Careers Live.
Thank you very much. It's great to be here in Altrincham, where the National Health Careers Conference first started 5 years ago. And since then, it's been doing a fantastic job communicating to many thousands of young people the great spectrum of different opportunities there are in the National Health Service and in the wider health sector, giving those young people the wonderful opportunity of fulfilling careers, serving the community and helping to make our country and the world a better place.
Here we are live at the NHS Parliamentary Awards, and it's so great to be here with Professor Stephen Parris.
Hello, my name is Stephen Parris and I'm the National Medical Director of the NHS in England. Now, believe it or not, it's probably nearly 45 years since I started working in healthcare as a medical student, but actually I did a few summer jobs packing cotton wool balls, 5 cotton wool balls into a sterile packet for use in operating theatres as a summer job. And I've worked in all sorts of jobs ever since, obviously mostly as a doctor in lots of different hospitals. And I finally got to become National Medical Director, which is a real honour and a privilege. But if you wind back 45, 50 years, I would never have imagined that I could have had such a wonderful career in healthcare. It really is the best thing that you could do, because fundamentally we are here, I am here to help others, to help fellow citizens and people at their most needy time when they are ill, and also ensuring, of course, that they keep well. And of course, you don't need to be a doctor. There are literally hundreds of jobs in healthcare. Of course, there's nurses, paramedics, but there's also porters and cleaners and informatics experts who make sure that all the IT is working and that we're looking to the future of artificial intelligence and all those things you read about. So whatever your background, whatever your interests, there is a career for you in health. And I would really encourage you, because it is the most wonderful career to have and the best possible place to work.
Each of our 14 allied health professions are unique by role and diverse in skills. So given your chosen profession and you are training to be a diagnostic radiographer, if radiography was a cocktail, what would you suggest are the key ingredients that need to be mixed together based on skills, interests, strengths, that would produce the best top-class diagnostic radiographer?
So back to BMJ best practice, essentially it's a knowledge resource that answers clinical questions, but it doesn't just give any answer. It focuses relentlessly on what is important to our users. And what's important to our users is speed. They want answers quickly, within seconds. They want practical, actionable information for use at the point of care that can deliver clinical quality improvement. They want to be assured that the content that they have is continually updated and evidence-based. and they want to be able to access it on a mobile, on an app, online and offline. More about that in a second.
Whatever stage of life you're at and whatever your academic level, there will be a route in for you. And that's a really important message, because I think sometimes people think, well, I haven't got a degree, or I'm not going to be able to get a degree, I won't be able to join the NHS. That's just not true.
For me, I think the whole issue is that when we think about how do we make the best clinical decision, there are three elements there. So one is about patients, their ideas, beliefs, and concerns and expectations. Clearly, we all want to follow evidence-based practice, but the third element is that individual clinical expertise. And I think that individual ourselves is often the forgotten bit. I think we forget the need to look after ourselves. We forget the need to empower ourselves and to feel empowered so that we can actually help our patients and use our expertise to help our patients.
Everybody always asks, well, why do I have to take BMAT? You know, why are you making me sort of do this? You've got my A-levels, you've got my application and so on. So for many medical schools, they actually have applications from a wide range of people who have all sorts of different qualifications. You know, even if we're looking at UK students, some of them will be from Scotland, they'll have hires, be from England, Wales, but also from other countries as well, and different sorts of qualifications. So the BMAT actually gives them one piece of information which is common to all of their applicants.
One of the things that is happening, and this is particularly important to say at this Health Careers Live, is that what medical schools are being increasingly expected to do is make sure that they're getting the right representation of society from their medical applicants. And that's quite a challenge. I don't want to go into detail, but what I'm saying is that we're trying to make it more equitable in terms of applications and who gets in terms of a cross-section of our society.
It's been a brilliant day bringing together so many different organisations, healthcare professionals, students from across the UK and beyond.
It's an amazing opportunity to learn about such a huge range of health careers. We hear a lot about like medicine and dentistry, but we don't often hear as much about the 350 roles within the NHS, and that's something that as a conference we hope to try and challenge, to get people to think beyond the courses that everyone knows about.
There's something for everyone, and it's from like undergraduates for students, all the way up until people who are graduated and are working.
We've got AHPs, we've got aspiring medical students, dental students, nursing students. So everyone's represented here.
It is designed to have something for literally anyone. No matter what you're interested in, we will have a talk that covers it.
This is a brilliant programme that brings together so many different professions within the healthcare community, and it's one that should definitely be on everyone's calendar.
Welcome to Health Careers Live.
Thank you very much. It's great to be here in Altrincham, where the National Health Careers Conference first started 5 years ago, and since then it's been doing a fantastic job communicating to many thousands of young people the great spectrum of different opportunities there are in the National Health Service and in the wider health sector, giving those young people the wonderful opportunity of fulfilling careers, serving the community and helping to make our country and the world a better place.
Here we are live at the NHS Parliamentary Awards, and it's so great to be here with Professor Stephen Parris.
Hello, my name is Stephen Parris and I'm the National Medical Director of the NHS in England. Now, believe it or not, it's probably nearly 45 years since I started working in healthcare as a medical student, but actually I did a few summer jobs packing cotton wool balls, 5 cotton wool balls into a sterile packet for use in operating theatres as a summer job. And I've worked in all sorts of jobs ever since, obviously mostly as a doctor in lots of different hospitals, and I finally got to become National Medical Director, which is a real honour and a privilege. But if you wind back 45, 50 years, I would never have imagined that I could have had such a wonderful career in healthcare. It really is the best thing that you could do, because fundamentally we are here, I am here to help others, to help fellow citizens and people at their most needy time when they are ill, and also ensuring, of course, that they keep well. And of course, you don't need to be a doctor. There are literally hundreds of jobs in healthcare. Of course, there's nurses, paramedics, but there's also porters and cleaners and informatics experts who make sure that all the IT is working and that we're looking to the future of artificial intelligence and all those things you read about. So whatever your background, whatever your interests, there is a career for you in health. And I would really encourage you, because it is the most wonderful career to have and the best possible place to work.